Human Services Committee, Wednesday, April 9th. It is our discussion and markup. Members, you should have in front of you Senate File 3054, and that is our Human Services Provisions Modifications, the Appropriation of Money and Budget Omnibus Bill. And as we're thinking about this, we think about the other body and we think about what the governor proposed and what we're doing in order to establish ourselves. So we have today, and in testifiers, if you just look at the timelines, there's a whole bunch. Try to get to the point. That would be appropriate, please, because then I know there's a bunch of amendments. Last time I looked, Utke had 20. Is that true? That's half of them? All right, so we're good on that one. So, members, I want to move to reconsider the vote by which the A1 was adopted. If we could vote on that motion, I'd appreciate that. All in favor say aye. Aye. Opposed, same sign. Now, members, I need to withdraw the A1 and I need to offer the A8 in its place. It's identical to the A1 except now, members, we had to put the appropriations article in that, and the appropriations article should be in your files. So with that, all those in favor of the A8 signify by saying aye. Aye. Opposed, same sign. Thank you. Now, you know, the way it's been going today, Paul, it's been kind of like that way. You know, we're in energy having a conversation, and I got pulled upstairs, and then they were like, "You need to come down because there was all these amendments." There was like 26 amendments. They did have an A19, and all I kept thinking in my head was that Steely Dan song, you know, A19. So, but I think we're going to be fine. Members, do you any comments from folks before we go to testifiers? If not, we'll just bring testifiers up. What are you guys thinking? We're good. We're good. EMQ is good. Glenn, you're typing over there. You good? You want to just get testifiers? Okay. So if you could come on up in Articles of 3, Shireen Gandhi, who is our temporary commissioner of the Department of Human Services. Are you in the house? Come on down. You are the first contestant. Josh Berg, you want to work your way down here from Minnesota Services and Strategic Growth, Accessibility Space, and then Mark Cullen. If you want to come down from Trellis, you guys can start working your way down. And in the batter's deck, Antanya Jeffrey, Brian Zervis, and then Lori Schultenhofer. So, and we'll just keep going from that. So, Madam Commissioner, welcome to the committee. The table's yours.
Thank you, Chair Hoffman and members of the Senate Human Services Finance and Policy Committee. For the record, my name is Shireen Gandhi, and I'm serving as the temporary commissioner for the Minnesota Department of Human Services. Thank you for your commitment to empowering people to thrive by building a human services system that is innovative, effective, accountable, responsive to the needs of Minnesotans. Developing a budget this session is especially challenging, and I'm pleased to see that your proposed bill includes both responsible reforms to address the projected budget shortfall, as well as investments that will improve people's lives.
Can you repeat that for me, Commissioner?
Thank you. Yeah, thank you. Chair Hoffman and members of the committee, I'm pleased to see that your proposed bill includes both responsible reforms as well as investments that will improve people's lives. I'm happy to indulge.
I was not kidding. Senator Abler, I just, you know, when you look at the other body's bill, Senator Abler is going to have comments about that later. It's nice that, because the work is never, this is hard work, Commissioner. It absolutely, because, you know, it's one thing, and I'm not going to, you know, putting ethanol at every gas pump is whatever. But if we talk about cutting services to the most vulnerable people in the state of Minnesota, people with disabilities, our elderly, and our poorest of the poor, those are life-altering decisions. And Senator Abler had this in 2011, and I remember that moment, and it's evident today. And so that same anxiety and the same feelings have not escaped. And so I just needed to make that point, and I appreciate your comments because it's not it's life and death for a lot of people. So
It
keep going,
is,
Commissioner.
and thank you for always thinking about the people at the heart of this. I also want to thank you for the inclusion of several of Governor Walz and Lieutenant Governor Flanagan's key budget priorities, including building on historic investments in the community first services and support so that people have meaningful options to live and work in their homes. This funding also ensures implementation of the self-directed workforce contract between SEIU Healthcare Minnesota and the state, including funding to implement standards adopted by the Nursing Home Workforce Standards Board. Good jobs are the foundation of an equitable economy, and the caring economy is the backbone of our human services system. Strengthening the health and safety protections for children and young adults with autism who use medical assistance, early, intensive, and developmental and behavioral intervention services. Prioritizing tribal sovereignty by creating a path for tribal nations to access federally funded rates for members who use vulnerable adults and developmental disabilities targeted case management. Utilizing data-based and person-centered approaches to address disability waiver spending, including aligning rate framework cost components with data, practical limits on training services, and distinct reimbursement for awake and asleep services. These approaches shield people and families from the blunt tools such as waiver caps and large-scale rate cuts. Reforming nursing facility reimbursement by repealing now obsolete incentives such as property rate inflation adjustments and paying facilities to close beds and facilities. Ensuring people who access substance use disorder services have access to comprehensive health care coverage under MA program. Shifting to new models of SUD treatment that integrate clinical and social supports while also facilitating transparent billing practices. These changes better support program accountability, individualized needs, and positive outcomes. Promoting improved care coordination and discharge planning for competency attainment programs. This change helps to ensure that individuals receive the proper care and support they need to effectively participate in legal proceedings. Funding the operating adjustment for state-operated safety net programs, which offer services for people with mental illness, substance use disorders, and developmental and intellectual disabilities. As a highly specialized healthcare system, direct care and treatment cannot operate programs without sufficient staffing to provide safe and effective treatment. We are excited to see investments to improve Minnesota's substance use disorder continuum of care that reflects DHS's recommendations to implement data-informed reimbursement rates. We are also pleased to see investments and innovations that allow community-first services and supports to be provided in short-term hospital stays. Both investments address the burgeoning workforce crisis that mend the cracks in the current service continuum. As this bill makes its way through the legislative process, we hope to continue dialogue about the governor and lieutenant governor's recommendation to expand recovery housing options and implement a certification for recovery residences. Considering threats to federal behavioral health grants and the opioid crisis, we hope to identify budget solutions that mitigate funding decreases to harm reduction, safe recovery site, and contingency fund grants. In the weeks ahead, our team will continue to analyze the bill and provide additional feedback and technical assistance as is helpful. I want to thank you, Chair Hoffman, and the committee for your commitment to keeping people at the center of what we do in human services.
Thank you, Commissioner. Senator Abler.
Oh, Ms. Gandhi, welcome to the committee. Been nice to have you around more. I know you have a few things to keep doing in your role, and it's you're kind of caught by surprise even to have the title. Temporary, it can last a long time sometimes. But,
I'm finding that out.
Commissioner, go ahead, Commissioner.
Yeah, I appreciate that.
I was saying your name.
We have, and so I'm not, I could talk to you for a long time, but I'm not going to. There's lots of things we have to do today. But I'm just concerned about everywhere we're going on this project. I think frankly, listen, Senator Hoffman, of the three bills, I think Senator Hoffman has put together the one that does the least harm and is probably the more thoughtful, well, the most thoughtful. There's three. It could be the most thoughtful approach to this. And there's some things we have to work through. And I think that, curiously enough, that the governor's position is chosen the middle, and the House bill is totally impossible to operate, except if you're a nursing home. And so there's a lot of work ahead. I just want to encourage you as we go forward. I don't even know who the governor is, and you're temporary, so clearly it wasn't you. But in your proposal, there's $460 million in shifts to counties. This one has a smaller number, and the House is gone. They pay for half their budget almost with county shifts, which are untenable. And I'm sure you're aware that when those shifts happen, they're going to go against single widows and people with disabilities and just average families who are just trying to make it work. And so that's not a pot of money, and it's no real solution. I just had a meeting with some caregivers, and they're on the edge anyway. And so I sat through, I would be less talking if I hadn't do this myself in 2011. And with inflation, it could have been, Senator Hoffman, $3.5 billion or something we had to do in one short cycle, and it was horrible. So as we go forward, I do have a request. I asked the governor this, and I don't know if we can do that, but there are things that we are doing in your bill and the Care Hub and some other things that we know are going to save money. Unless we want to just simply do rank cuts to everything to come up with a number, and then as we do a few of these things we can barely afford to do, and those savings show up in the forecast so we can buy tax cuts and roads, it would be nice if there'd be a way, as you chat with your staff, to bring the savings we know are going to come, particularly in the first year of the biennium, because we can fix it up later if we mess up, but to bring those savings into the fiscal notes. I'll give you one case in point, and then I'll stop, Mr. Chair. So the EIDBI.
You don't have to, Jim.
Senator Hoffman has invested, well, I guess you've suggested that we invest, and we're going to probably agree with that today, at least as a starter. But we put $24 million into an EIDBI program, which, by the way, I think I'm working to make it even work better. So you can watch for that, and I'll work with you in the department, because I think it's not going to accomplish what you want. That's a different, but after spending $24 million, your notes don't show 1 penny of savings in an area that's out of control. And so I have to think that with what you're doing there, that you would run off some of the providers who are not doing good work, or you would kind of clamp down on 2 of the modalities that are not even proven. So, and there should be a number of savings in there. So if we can't get savings from that, how are we going to, we're going to have just a world of hurt to get a bill out of here that actually doesn't ruin everything. But actually, with that kind of approach, we actually can do some reforms and make the thing better. And in the words of my mentor, Rahm Emanuel, don't waste a good crisis. Don't waste a crisis. And so, he's not really my mentor, but I thought it's really smart to say
It's too late. You already said it's on the record.
Yeah, put that on the thing.
Glenn was looking at you.
There goes my endorsement. Sorry, Republicans. Anyway, but that one specific thing, and I mentioned to the governor, I said, could you, when he thanked me for the Medicaid letter, because we all care about that, and that's a big worry. I said, could you talk to your MMB and the EBOs and the LEBOs and see if they can find a way to truly consider the impact, not 6 layers down, but at least the immediate one that's going to do something. And finally, I just want to offer to you that by shifting to the counties and by doing some of the things that are in this bill and in the health bill, that we're burning up our opportunities to try to soften the blow for the changes we know are coming from the feds. So, but I appreciate you being here, and hopefully that was a friendly way to chat with you. So thank you, Commissioner.
Appreciate that. Commissioner, is a follow-up, or it was just words of comments? Is anything you want to say in response to that, or should we just go to Senator Rasmussen and let it go at that? So.
Yeah. Chair Hoffman, Senator Abler, appreciate your longstanding work on this committee, and I know that you have worked a long time with our legislative and budget staff, and so we look forward to continuing to partner with you and to work on coming to a successful resolution. So thank you for your comments.
Thank you, Mr. Chair.
Thank you, Senator Abler. Thank you, Madam Commissioner, for that. As we look into this, I know Senator Abler is working hard on the EIDBI stuff. I mean, there's a bunch of, and he's pulling in some people on that. And I think that's a tradition he started years ago, is to go find people that are, what they're good at working on and go work on that stuff. And so as this committee, that's how we work. And so I appreciate the department's full support of what Senator Abler is asking for some help on, and that in the same Senator Rasmussen and Senator Aaron McQuaid are also working on some things together jointly. So with that, Senator Rasmussen.
Thank you, Mr. Chair. Question for the Commissioner. Commissioner, one of the big items of concern that Senate Republicans and Republicans of this committee, and I think Democrats share as well, is around public services fraud. And early on, when we had the opportunity, we had you here, we had a hearing on this, and as a part of that hearing, we heard some of the ideas that the governor had proposed, including one for upgrading technology, and especially utilizing AI technology to be able to spot patterns of fraud or issues that would help the program integrity individuals at DHS to be able to focus their efforts to try to root out public services fraud. And I noticed when we came out with the HHS budget bill and this budget bill that there isn't funding for that proposal from DHS to have that technology. And I just wanted to ask Commissioner, what does that mean for your anti-fraud work going forward? Will this hamper your efforts to try to identify and root out fraud within human services?
Commissioner.
Chair Hoffman, Senator Rasmussen, I believe that there's great opportunity with technology. We have rapidly increasing number of claims, people that are served, dollars being spent, and technology is improving at a very fast rate. And so if we are able to identify funding that would allow us to put AI, machine learning, case management, modern tools in place, that would help us protect those dollars that we want to invest for the very people that Senator Hoffman said are so important to serve, and ensure that those dollars are going to the very people that we're trying to help.
Thank you. Senator Rasmussen.
Thank you, Mr. Chair, and thank you, Commissioner. And I think that's, and there are additional FTEs, right, that are being put towards program integrity, and I think that's a good thing. But I worry that without that technology piece, just given the number of providers, the number of Minnesotans receiving these services, it'll just be very challenging to be able to prioritize that. And so I think that's one missing piece when we look across the entire health and human services portfolio. And then one additional question, Mr. Chair, for the Commissioner. And I'm not trying to get into a debate on this issue on the merits, but I just want to try to understand the governor's position a little bit. We have both in this budget bill, across the street in their budget bill, in the governor's plan, there are cuts to nursing homes, there's cuts to disability services providers, there's county cost share shifts. But one of the things that we haven't seen from the administration a willingness to cut is free health care for illegal immigrants. And one of the things that I look at is that that's a particularly expensive benefit for Minnesotans because we miss out on the federal match. And so for every dollar we're spending on that new program, which just started here in January 1 of this year, that's $2 that we could be using for nursing homes, for disability services, for some of these other priorities. And so I just wanted to, again, we don't have to get in the argument, I just wanted to understand why the governor is prioritizing spending money on free health care for illegal immigrants, but is okay cutting disability services, nursing homes, and increasing property taxes.
Thank you. One of the things we talk about words, and I appreciate the question because you're real. The essence of your question is about why aren't we taking advantage of the 2-for-1, right? we continually use this word illegal, and I would hope our committee, just like the old words like gross, moronic, and idiotic all started in state institutions. You know, it's like we've just, you know what I mean? And so I'm not calling you out, but I'm just saying I always, when I hear that, I kind of shudder a little bit, because then I lose essence of truly your essence question is, why aren't we taking advantage of a 2-for-1, right? I mean, that's really the essence of your question, Jordan. So I appreciate that. One of the things that we had talked about was, you know, get their position, and if we want to bring the commissioner back, because there's lots of questions regarding this budget, and I'm just wondering, do we want to take our time having those questions at the table, or can we move on to folks to really get their reasons, other reasons why, and then maybe come back to that? I mean, we got, you know, help me with that, Jordan. I just, you know what I mean?
Thank you, Mr. Chair. I think we have the commissioner here, and I just want to better understand the positions that the governor is advocating for as we continue through the budget process. So I think it's a fair question for the commissioner to answer.
All right, and then we should move on. So, Commissioner, you just want to comment from what you do know and what you have, and then we're going to move on to Josh Berg. So,
Chair Hoffman, Senator Rasmussen, I think that when we have the budget that we're looking at this year, there's a lot of tough choices to make, and you know, we will continue to work with this committee as it moves forward, and to all the committees working on the governor's budget to make the best decisions for the state of Minnesota.
and also, I think, you're working on some of the discussions we had too, is you got the folks from DHS working on proposals that we're either going to see on the floor or in finance or somewhere, especially, we know what we're going to have to do to get, you know, ready for conference committee, and the Senate's going to have to, you know, dig in with our knowledge. We know, Senator Abel just pointed it out, he kind of layered it out, you know, he does his essential, important, and nice thing he did. Well, so far the Senate's winning the essential category, and then, you know, the governor's budget, and then of course the House one. But I think we should, in the interest of time, Senator, can we just have one more comment? Glenn, if you bring up that word illegal, I might take you out in the hallway, and we're gonna, you know, I'm kidding, but wait, Glenn, just go to Jordan first, if that's okay.
Thank you, Mr. Chair, and I do appreciate the continued work with the team at the Department of Human Services to come up with different ideas, some of which are in this bill and some of which I hope are in a final product.
Okay.
But Mr. Chair, I kind of, you know, thought that was a little bit of a non-answer from the commissioner in terms of just the important priorities and trade-offs that we have to make. And the reason this matters is this falls within the Health and Human Services budget.
Huge.
And when we look at the gap that your bill is trying to fill, and the gap that the other body is trying to fill, and the gap the governor is trying to fill, there are trade-offs. And it doesn't mean that if we had unlimited money, we would like to do all these things, but I just wanted to ask about that key trade-off, because it's big. If we look at the 4-year cost of it's about $220 million. So it's not a small thing. It's a meaningful public policy choice that impacts a lot of dollars and has an impact on the work this committee does too.
So let's stick with that, right? That jurisdiction, that $220 million sits in the Health and Human Services side, doesn't sit in the Human Services side. So, you know, not to steal words from, you know, the former chair of this committee for 6 years, how do you go capture those, you know, without, you know, because you were supposed to stay by process, right? Anyway, I think you and I should continue that conversation. That's because I'm interested in knowing, how do you get advantage of the 2-for-1, yet it's not within our jurisdiction, which brings up another point. We had jurisdiction problems at the very beginning. There are some things at this committee that the other body aligns up, and I've got nothing but crickets over here. And so, believe me, that's a distrust and distasteful piece as well. Those jurisdictional moments should have been aligned up so that we aren't here. So, but I appreciate you doing that. Glenn, talk about the Playmore Ballroom, if you would. Okay. I need something happy in my life.
I'll think about that.
I used to bowl there. Did you know that? I played there too.
Yeah, it is in my hometown. But anyway, thank you, Mr. Chair. Yeah, Commissioner, you know, I did do a little bit of research on fraud. I'm not an expert, but I did watch a YouTube, and it was put on by some of the Doge committee members at the federal level. And one of the things they said that impressed me was that you can talk to people all you want, and it's not going to do too much as far as fraud's concerned. You have to get technology inside of the computer that's generating the checks that alerts you to inconsistencies and also the ability to flag a potential fraud. Now, I just, with... Well, I don't think it's the commissioner right now, but I mean, if there's something that... Yeah. Is that what they are? Did you have something, or did somebody approach you with something? Well, and I heard there was some money in the... The Dodger either, because I'll whatever. What, do you prefer illegal rather than doing Okay. Anyway, the point is this. I'm not trying to say yay or nay, regardless where you stand on that. The point is that one of the reasons they've been able to identify so much of the waste, fraud, and abuse at the federal level is that they get inside of the computers with software and technology to detect where these checks are actually going. And the interesting thing, most banks have something similar that they actually operate with. I recently made a purchase from an organization I hadn't ever before, and all of a sudden I got it.
Jay, what's up?
Pardon?
I don't know where that came from, Glenn. That was the oddest thing. That was God.
Yeah, maybe that was God
saying, "Glenn, get to your point. We got so much to do today. So, Glenn, just get to your point, okay? Please,
I will
Glenn.
get to the point. So the point is,
I know where you live, for crying out loud.
Yeah, I know
get to your point.
Okay. So now you're making me laugh. But anyway. This is a serious subject.
I'm glad, Glenn.
The thing is, unless you get inside of those computers with proper technology like a bank does, and again, I made a purchase from an organization that I hadn't. All of a sudden, it was blocked. I got a text from my bank saying potential fraud. So I had to call in and tell them it was approved. So the point is, that technology is out there, and yet the research I've done, we're not using it in government.
I'll take that.
And I think that would go a long ways to preventing some of the $611 million that we've lost here. The other thing, I just got a quick question on, Mr. Chair.
Hey, Glenn,
Yep.
we got to get going. So,
Okay.
I'm honest to God, seriously. So let's
right.
leave the commissioner alone on questions. I need to take testimony from people. I'm not going to sit here and wait anymore on questions. If you got a question for, please,
Okay.
can you make it really like short? And I don't
real
mean
quick.
I don't mean to push you, Glenn, but I'm looking at Senator Ayler used to do 2 minutes, 2 minutes, 2 minutes. Let's get going
Yeah,
here. So
real
you know what I
quick.
mean? And I appreciate you.
One of the things I see is a lot of money going out to nonprofits in the bill, from line 402 on, about 15 of them. Is that going through an agency so we have some double checking, or is that just one-time direct contributions to those nonprofits?
So that's actually the committee. We'll go and have those conversations within ours. Those were our markups on it, and we have done in the history, done one time, and we've also done tail stuff. So Senator Rasmussen.
Thank you, Mr. Chair. And I think Senator Gruenhagen had a question there for the commissioner, which is, for these direct appropriations going to nonprofits, what's the department's level of confidence that these dollars are going to go towards what their intended purpose is? And just want to make sure we understand the level of.
Are you talking about in the past, or are you talking about in the future? What are you talking about
in
here?
the future.
Okay.
Yeah, talking about the future.
So, the department I know does have their own set of goods. Matter of fact, this committee has complained about when we've given single appropriations to organizations that we know that the process has taken forever, for example. How many times, and everybody in this committee has done that, been calling Christy Graham saying, why is it taking 6 months? Why does the MMB process? You know what I mean? And so I don't know the answer to that. I just know it's a pretty convoluted. If you have an idea of how that could be different, I think that's a different conversation than going into the future. But we've always had complaints about why does it take so long. For example, if we do a grant like we did one for the Mayo Clinic, right, which is doing some really amazing things, it took almost a year. So now in our bill here, we're now extending that grant for a year because I don't know if it was the department or MMB or whatever the process was. There's a whole systems process piece there I think is worth the conversation. I don't think she has the answer to that because we've all been here saying that we are critical of how it's done now in the place. So that's my take on it, Jordan. I think we can maybe fix it. You know what I mean? Unless you want to answer that question, if you have the spot-on answer. Senator Mayquade.
Thank you, Mr. Chair. I'm just looking at the long list of testifiers and the long list of amendments, and I'm just wondering if we might maybe do our commentary after and while we do amendments?
I would like that. I am not in a space to get into a debate. Commissioner, thank you for coming. You can go back, please. I'm going to go on to, let's do Josh Berg and Mark Cullen, if you can please start. I appreciate you guys.
I have a question for the commissioner.
Glenn, did you hear that? He was trying to be funny over here. Yes, I do. Tell Fateh he's out of line. Thank you.
Thank you, Mr. Chair and members. For the record, my name is Josh Berg, and I represent a nonprofit based in St. Paul and serve on several boards of directors, including Trellis, the Metro Area Agency on Aging that operates the Juniper program, which supports older adults and their caregivers in communities across Minnesota. I appreciate the opportunity to offer brief comments on the Human Services Omnibus bill as currently drafted. Quickly to the provisions that fully support, and this includes, among several, the more flexibility with the assessment process, recommendations for improvements to the cost reporting system, and the inclusion of the Disability Services Technology Grant. I especially appreciate how it appears that DHS may finally start to be held accountable for its significant lack of compliance with state law in terms of reviewing and processing complete applications. I would suggest that even more action is taken, but the language in Article 2, Section 1 will be a good place to start and continue that conversation. Also, as a member of Trellis and Juniper boards of directors, and on behalf of almost 60 additional supporting organizations signed on to Senate File 554, thank you, Senator Abler, for carrying this language along with Senator Utke, Senator Hoffman, Senator Mayquade, and Senator Mann. And thank you, Chair and committee members, for including this in the early versions of this bill. This will be a legacy bill that will be looked back on and acknowledged as a catalyst for new and innovative approaches to how we serve older adults throughout Minnesota and how we budget for, capture, and reinvest those savings into our fiscal budgeting process. Moving on, at this time, our team is still evaluating the potential impacts of some of the other provisions, including the proposed modifications to the nursing facility level of care criteria for CADI and BI, the switch to using CPI data and calculating base wage index adjustments, and the limitations to rate exceptions. But I do feel with everything else being considered, especially the other budget versions being proposed, we can probably be okay with what is being proposed here. And finally, the only section I want to comment on that is included that I feel needs to be worked on or considered to be removed is related to the delay in waiver reimagine. I do disagree with the idea of delaying the implementation of waiver reimagine, which I see as an unnecessary waste of nearly $50 million. The cool thing, however, that I noticed last night is that the language proposed starting on lines 96.8 of the A8 amendment that would prohibit home care nursing for individuals receiving ICS inadvertently and unintentionally highlights, so thank you, Mr. Chair, what I and others have been stating for years, the need for nursing services to be reimbursed within the ICS framework. Without something like Senate File 94 that you, Mr. Chair, carried again this year, which we heard in the committee for the third time this year, essential nursing services will be cut and access will be further limited for those who need it most. Instead of paying to delay the simplifying, streamlining, and improvements of the system and causing additional access issues, let's put that money to better use. Honestly, Mr. Chair and members, Senate File 3054 is definitely a great place to start, considering the targets you were afforded by leadership and what cards you had been dealt. I appreciate the attempt to balance out the cuts across the various different sectors and areas, and appreciate this bill does not balance the budget on the backs of individuals with disabilities like the other bodies and the governor's proposals do. If we are comparing bananas, Mr. Chair and Senator Abler, this one may still have a slight hint of green to it, but it only needs another few minor tweaks or so to ripen into something delicious, whereas the other versions are badly bruised, almost entirely brown, and extremely mushy and inedible.
You like that?
As I mentioned last week, and as always, I look forward to collaborating with you, the departments, the other body, and the governor's office as we navigate the challenging decisions that lie ahead. Mr. Chair and members, together we can find our way through these difficult times, and I want to personally thank each and every one of you for all you do for Minnesota.
You know, after that, Utke, I think I just want to adjourn and go home. And that was like, you know.
That's right, but I do appreciate Mr. Berg because he always works in a comment that we just made at the last committee hearing. So he's paying attention. He's
It was
doing his
like-
job. Thank you.
Josh, thank you, and thanks for your help on getting us to where, this has been tough. This is not, it is. It'd be emotionally and physically tough, and I appreciate the comments and the work on that. Mark Cullen, and then Antonia, you're here. Brian Zervas, you want to come on down too, get on deck. So, Mr. Cullen, welcome.
Thank you, and now I'm hungry for banana bread. This is terrible. All right, Mark Cullen, Vice President of Strategy and Business Development at Trellis, a community-based organization helping Minnesotans thrive as they age. On behalf of our organization and the 59 partners from across Minnesota supporting Senate File 554, we thank you for including this bill in today's discussion. Many of us have experienced the complexities of caring for our loved ones and our neighbors and receiving care from our state's fantastic healthcare providers. Navigating the healthcare system can be challenging, especially when additional social support is lacking. The reality is that needing help isn't a question of if, it's a question of when. Now, as I mentioned last time I spoke with you, these issues are present in big towns and the small communities like the ones I grew up in. We will all face these things eventually, and we will have to find ways to come together on this and so many other issues. Now, other states have recognized these challenges and have taken action. For instance, in North Carolina, in their Healthy Opportunities pilot program, similar to our vision for Minnesota, they're reporting preliminary savings of $85 per member per month in a Medicaid population. Their state is preparing to capture these savings and will be positioned to reduce program costs or reallocate dollars to other worthy investments. If we applied the same savings calculation to the approximately 124,000 older Minnesotans enrolled today in elderly and special needs products this month, we would see $126,480,000 in savings this year alone after paying the community-based organizations to deliver the services. Expanding beyond older folks would yield even more savings. Now, last session, this committee helped to facilitate an appropriation for a planning grant that allowed us a head start in this work. In fact, Senator Rasmussen heard from some folks in your community this morning about what has happened there because of an investment like the one you made. And so we're getting a head start on these things, and we're producing tangible results. One of those results is, though we are early in measuring these outcomes, we're already seeing statistically significant pain reduction and mobility improvement from services focused on people experiencing knee osteoarthritis, as measured by our partner health system. Measurement of cost savings is expected in the fall of 2025. The delay is due to the claims adjudication process, so there's a delay between when the service happens and when we can apply dollars and cents to the savings. Senate File 554 provides an investment of $9.9 million to enhance this kind of infrastructure across Minnesota, enabling further exploration of these potential savings. This effort, supported by 59 organizations across our state, will centralize essential services like data analysis, compliance, contracting, and training, resources that are often beyond the reach of small community-based organizations. By strengthening this infrastructure, we can provide personalized support to more individuals and their caregivers during critical times. Thank you for considering this effort and for including it in your deliberations today, and we appreciate your commitment to innovation and demonstrating new value for these important investments in social care.
Thank you, Mr. Cullen.
Thank you.
Ms. Jeffrey. Is that online? One minute, please. Brian, go. I'll figure out the rest of these. Do you want to please state your name? I'm sorry, I'm looking at you guys like I'm...
Me?
Yes, please.
Lori Schlutenhofer.
Lori Schlutenhofer, not Antoni Jeffrey. I had that in here. Lori, I knew I was looking at you going, that's Lori.
Yeah.
I apologize.
Hey.
Did you know that 25% of our population in Minnesota is 65 or older?
It's easy to believe.
Yeah, I just
Yeah.
want to make sure everybody knows that. Okay. Go ahead, Lori.
All right, thank you. Mr. Chair, members of the committee, I'm Lori Schlutenhofer with Opportunity Partners, a disability service provider in the Metro. We offer employment, day, and residential services. I'm here today on behalf of MORE, an association of over 100 organizations, nonprofit organizations across the state who provide day and employment services to Minnesotans with disabilities. And I will be commenting on file 3054. I want to start my brief testimony with a thank you and a nod of appreciation. We know that everybody on this committee is here, not because they want to make hard decisions, but when they do have to make hard decisions, make them with heart. And we can see that, and I want to applaud some of the components of the bill that we have looked at. First, I want to express our deep appreciation for the investments proposed in the bill to maintain adjustments to the competitive workforce factor in the disability waiver service system. This factor is an important part of our reimbursement system, making it possible for us over the last many years to creep closer and closer to making sure that those direct support professionals supporting Minnesotans who are aging and dealing with disabilities at wages that are more comparable with the private workforce. The governor's proposal, which we are really happy you did not accept, would be a significant step backwards. We do have some initial concern with the proposal to remove the use of data from the Bureau of Labor Statistics from calculating those wage adjustments in the DWRS system. And mainly that's because we haven't had adequate time to really model that out and see what the impact is and if that will be a significant barrier to continuing to make progress on wages. I would also like to speak to the proposal included in your omnibus bill that reduces the absence and utilization factor for day services from the current 9.4% that is in law to 3.9%. This proposal really translates to an across-the-board rate reduction of 5 to 6% for people receiving day services. It's the impact on providers. We have many providers who have been listening, have been leaning into the conversation about highly individualized community-based services that really impact the lives of people with disabilities. And we have not put in place policies to limit or have attendance expectations. Pulling back that utilization factor may force more providers into that mix. But again, I want to end with some sincere gratitude for the work that you're all doing and the work that you're staying committed to as we go through the next several weeks. And thank you for the opportunity.
Thanks a lot. Hey, how'd I get here? Just advice to the testifiers. Thanks, you can run along if you want. Or you can stay there and watch. It's a cool seat. So if Mr. Solberg and Mr. Freeman want to come down. To the testifiers, just if you really want to be effective, a lot of us know you like a lot of things in the bill. Some things that are in the bill are going to have a hard time staying, but we're going to try to keep all the good stuff. But if you can point out the concerns you have about things that are still in there that are maybe useful to us as we try to parse out the differences, that would be a good way for people to spend their 2 minutes. Mr. Zerbison, you can have 2.5 minutes because I just gave that instruction, so thank you.
Thank you, Mr. Chair, committee members. My name is Brian Zerbis. I'm the Executive Director of March. I got my timer going, so we'll hopefully be within 2.5 minutes. First, wanted to thank authors Utke, Abler, and Hoffman for the rates bill. The SUD, or adding in the SUD rate recommendations, was a huge win for a lot of providers. So a lot of time and effort has gone into that, so we want to thank you for that. Moving on to some areas of feedback, criticism, concern. Article 3, Section 31, the part where it talks about the rates. One item in line 126.21 identifies high-intense residential programs, ASAM 3.5, that do not seem to have a rate increase attached to them. We'd like to ask consideration for that. Those programs certainly have costs to manage as well. On the same section, line 126.22, the language reads 55% of the modeled rate. Just want to note caution, as that language is currently written, to use the group rate, for example, is $42.02. The modeled rate that was identified is $42.97. If you take 55% of the modeled rate, you'd actually result in a cut to that rate. So we just want to make sure that the language is correct and meets the intended outcome. The other area or section of concern is section 27. It's related to behavioral health fund eligibility. And then also in line 118.11 is a 60-day limit to behavioral health fund eligibility for individuals. So these two parts of concerns, one is moving eligibility from currently the counties to the state with a limited number of FTEs. Providers have concern that that's going to create a bottleneck. Also, having a 60-day limit of eligibility for the behavioral health fund may have adverse impact to clients trying to access services. So to use the analogy, everyone likes cake. If you take cake out of the oven too soon, it's a goopy mess. Yeah. The behavioral health fund eligibility and 60-day limit, we'd say keep that one in the oven. Let's keep working on it and give it some time. Thank you for hearing us out, and we look forward to ongoing collaboration.
Well, thank you. And just one more advice to the testifiers from the next couple minutes I'll be sitting here. There's a lot of things that you're concerned about. Many of you have written letters. I would just suggest going forward, as you hope that something can be tweaked, that you make sure that that information gets to Senator Hoffman and Mr. Zach in particular, just with the itemized things about technical changes. There may be a reason for that. There may be a mistake. But we don't want to do any more harm than we have to. So thank you. Welcome. And then, so you're there. And then, Mr. Freeman, are you here? You can come down, or did you forget to come? Lou Zeidner and... are they here? Yeah. And then Mr. Ackert. So go ahead. Welcome. Okay. And just try to keep it succinct. And our attention span is actually not as long as you think, so thank you.
Right. Chair Hoffman and members of the committee, my name is Victor Solberg, and I work and live in Nashwauk, Minnesota. I am a home care worker, and I am testifying on behalf of my union, SEIU Healthcare Minnesota and Iowa. We represent over 55,000 workers in hospitals, clinics, nursing homes, and self-directed home care. I want to thank you for two important parts of your bill. First, your Omnibus funds the minimum wage rule for the Nursing Home Workforce Standards Board. The rule provides an industry-wide minimum wage of $19 an hour in 2026 and $20.50 the year after. There are higher minimum wages for CNAs, TMAs, and LPNs. You can have confidence that the money will go to workers and will ensure quality care for our seniors. Second, you fund the tentative contract for SEIU home care workers in 4 home care programs, including PCA Choice, the CFSS budget model, the CDCS program, and the Consumer Support Grant. My mother, who is my client, has needed home care since she had breast cancer almost 20 years ago. In 2023, she lost her last PCA when she had a long nursing home stay after a knee replacement surgery. We couldn't find anyone new at the time, so I had to give up my full-time job to work as her PCA. My mom has congestive heart failure, diabetes, and a host of other conditions, along with being a breast cancer survivor. Without me, she would be directly in a nursing home, and I wish I didn't have to sacrifice so much to keep her with our family. The contract will make things better. I'm excited about the $1,200 bonus that will be able to help with medical expenses. I currently don't have dental insurance, so I'm hoping to be able to get a dentist to fix some of the cavities I know are just getting worse absolutely every day. This contract also gives me some hope for a retirement plan. It does not immediately put any money into a retirement plan, but it sets up the infrastructure for some employer-funded individual accounts in the future. I hope our next contract we can bargain over some kind of contribution. I can't build my family with my partner of over 10 years without some kind of plan for the future like this. Both proposals directly fund wage and benefit increases for critical frontline workers who provide essential services for seniors and the disabled. These programs have always received strong bipartisan support. I thank you all.
Thank you very much, and I think you're about right on time. So it's a competition. Who can get the closest to 2 minutes and 30 seconds? So Mr. Freeman, welcome to the committee, and you're on.
Thank you. We weren't sure which Freeman, so I just came down. Good morning, good afternoon. For the record, my name is Robert Freeman, and I'm the Vice President of Public Policy for the Alzheimer's Association Minnesota North Dakota chapter. On behalf of the more than 100,000 Minnesotans with Alzheimer's disease or some other form of dementia and the 164,000 unpaid caregivers who look after them, I wanted to thank the committee for including Senate File 1689 in your Omnibus, Senator Kupek's bipartisan bill, providing funding for competitive grants to communities across Minnesota to increase awareness of Alzheimer's disease and other dementias, promote the benefits of screening for early identification of dementia, increase the rate of cognitive testing in the population at risk, and connecting family, friends, and neighbors who are caregiving to education, support, and resources. As I mentioned in committee previously, this funding prioritizes geographic diversity, tribal nations, veterans, and underserved populations. This bill is also supported by the Long-Term Care Associations, AARP, Catholic Charities, Minnesota Area Agencies on Aging, Elder Justice, Lutheran Social Services, the Minnesota Home Care Association, Volunteers of America, and numerous other organizations working to help elder Minnesotans. We're so grateful for your support of Minnesota families impacted by dementia. I'm sorry I don't have any food analogies for you to laugh at, but thank you so much for your support.
Oh, thank you, and I appreciate that, the no food analogies. Mr. Eckert, if you're around, and then Katrin Bachmeyer. So there you go. Welcome, sir.
Thank you, Zeidner. Mr.
Yeah,
Chairman.
I just said sir, yeah.
Okay. And members, my name is Dr. Lou Zeidner, and I serve as the CEO of EOSIS, formerly known as Meridian Behavioral Health. We represent about 25% of the Medicaid beds for high-intensity residential SUD services in the state. High-intensity residential SUD care is an initial access point for care for patients struggling with drugs and alcohol. Obstacles to recovery for many include getting away from the environment where they use and being able to clear their bodies and minds long enough to begin making the behavioral changes they need to enter long-term recovery. We have seen the bill draft that reflects no increase in 2026 or 2027 for high-intensity residential care. Denying financial sustainability for high-intensity residential programs, even while funding lower-intensity programs, will reduce access to care for thousands of Minnesota residents who need a safe, drug-free environment with intensive levels of treatment and support to initially stop using drugs and alcohol. It's like adding lanes to the highway while restricting the access ramp. As I have previously testified, without a rate increase for high-intensity residential SUD services, we will go out of business before the end of this year. The 8,000 Medicaid and behavioral health fund patients that we treat each year will lose access to care that we provide. Currently, the gap between our cost of providing care and our Medicaid reimbursement is $60 per patient day. We lose $60 for each patient each day they are in care. I have heard that there is confusion about the 1115 rates implemented in recent years. Those were not rate increases. They provide incremental payment and at the same time require substantial incremental provider costs to meet the needs of patients with co-occurring psychiatric illness. They increase access for complex patients, but they did not relieve the financial burdens of high-intensity residential care. I am used to clinical and business challenges, but I have never before found my organization in this level of desperation. I beg this group to find some monies to help sustain high-intensity residential substance use disorder treatment in Minnesota. Thank you.
Well, thank you. And is it Dr. Zeider? Yours is an example of something that oral testimony is almost impossible to follow. I mean, you said it as well as you can. You live in this world, but I would suggest that you kind of annotate something. And if there's a way, I talked to the commissioner, if there's some way we can show we do this that actually saves money, the system is not geared toward that. But if you can annotate your thoughts and particularly get it to the chair and to David Zach. Just to encourage everybody here, the chair's job is horrible in this situation. I did it 10 years ago or 12. But the more information you get that's succinct and say, could you do this instead? This would be another way. If you have a better way to do some of this stuff, none of us want to do any of this. So thank you. Appreciate it.
Thank you.
Mr. Heckert's there, and then if Karen Bachmeyer, Katrin Bachmeyer, and then the Hubert Burnt show. So So actually, when one chair clears out, the two of you can come down. Mr. Ackert, welcome.
Thank you, Mr. Chair and members. My name is Danny Ackert with the Minnesota Hospital Association. First, MHA fully recognizes the difficult budget constraints impacting the decisions that this committee has had to make in putting together the Senate File 3054DE. Going forward, we urge the committee to continue supporting the recommendations and ongoing work of the Priority Admissions Task Force. I want to thank Senators Rasmussen and Abler for continuing to work with all the stakeholders to bring forth the best recommendations possible this year. To that, we strongly support the exception of adding up to 10 civilly committed patients, community hospital patients, to the wait list for priority admissions to DCT. This exception will better serve civilly committed patients needing care at DCT and will also increase the capacity at community hospitals, freeing up units and beds that Minnesotans need today. Additionally, and this is important, ongoing and dedicated funding for capital investment and workforce to increase capacity at DCT is imperative. Therefore, we urge this committee to support Senate File 2901, authored by Senator Abler, and its proposed bonding-supported expansion of Anoka Metro Regional Treatment Center. Further, MHA supports the proposed changes to MnChoice's reassessment in Article 2, Section 14. MHA also supports additional provisions expanding who can be MnChoice's assessors, clarifying process timelines, and strengthening accountability within the MnChoice's system. We understand that those provisions are not in the bill currently, but ongoing conversations are happening right now, and we urge this committee's support. Lastly, MHA supports the extension of the supported decision-making grants in Article 10, Section 1. Supported decision-making prevents the use of guardianship when it's not needed and keeps those resources reserved for those who do need them across our state. So in closing, we look forward to working with this committee in advancing the recommendations of the Priority Admissions Task Force and ensuring that Minnesotans can get the care they need when and where they need it. Thank you.
Thanks, Mr. Ackert. We appreciate your partnership. And so Kyle and Aaron, you can just come down there. Welcome.
Thank you. My name is Reverend Katrine Bachmeyer, and I am a caregiver advocate for over 2 decades in Minnesota. I also help administrate some of Minnesota's largest support groups. I'm actually going to pivot today because Kathy Ware actually drafted this amendment, and she's unwell today, so she has sent me her testimony. Chair and members of the committee, on behalf of Kathy Ware and her son Kylan, I'm here to speak in support of the revised amendment in SF 3054, specifically the language that allows individuals to self-direct their home care nursing assessment dollars. Kathy is the mother and guardian of Kylan Ware, who is her 30-year-old son, who has profound disabilities and complex medical needs. He qualifies for hospital level of care in the community. This revised amendment simply restores equity. It does not eliminate the option to use a traditional nursing agency, but it does allow those of us providing around-the-clock skilled care at home to use the nursing assessment equivalent to self-direct care. That means hiring qualified nurses directly or even training family caregivers under supervision to better meet real-world needs and realities. Please support this revised amendment. Self-direction of nursing care has been eliminated under Consumer Support Grant and Waiver Reimagine, and it will eliminate the self-direction of nursing. Please give Minnesotans every opportunity to care for their family members in their home. Thank you on behalf of Kathy Ware and her son Kylan.
Well, thank you.
Thank you.
Clearly, I'm not good at this anymore, so I messed up. So Aaliyah Wagner and Debbie Harris, and then the other pair. So I apologize.
That's okay. Thank you, Senator Abler.
Welcome.
Thank you. I'm Debbie Harris. I'm from Eagan, and I'm here in support of the A4 amendment. I'm here on behalf of my son Joshua, who is back there. I thank you for taking time to listen to us today. Joshua is 32 years old, and he is on a CAC waiver. He receives nursing level care in our home, hospital level of care. He is on a ventilator about 8 hours a day. He has an oximeter 24 hours a day, a cough assist machine. He's on continuous pump feedings. He has an intrathecal baclofen pump, and he's on oxygen about up to maybe 8 hours a day as well. And the CAC waiver under the CDCS the flexibility of the CDCS budget has allowed us to hire people who are nurses, who are trained and committed to Josh's care, and we're able to pay them a competitive wage so that they can have a sustained career with Joshua, and we can keep people who are committed and qualified and trained. And so on Friday, we had Josh's 6-month assessment with his county case manager, and one of the things she remarked upon was that we were very fortunate to still have 3 nurses on Josh's staff. And one thing that I said was that it's not by accident, but it's intentional. And we're able to do that because we're blessed to have the CDCS under the CAC waiver, and we use it creatively and flexibly in order to bring people into Josh's life that make sure that he's safe. And so I'm just here to support this amendment so we continue to do that, so Josh can still come into the community with his nurse. Mary is here with him right now. Mary's been with us. This is her 10th year. We have another nurse who's going on 10 years, and we have a night nurse. In addition to that, we're able to have people who are direct support professionals, our 2 sons and my husband, who work with Josh and provide the 24-hour care that he needs to be home and when it's safe for him to come into the community. So I appreciate your listening to us again today. We were here a couple of weeks ago, and just urge you to support the amendment. Thank you.
Thank you, Ms. Harris.
Thank
Much
you.
obliged. Kyle and Aaron, if you want to come down, go ahead, please.
Hello, my name is Aaliyah Wegener, and I am here in support of Bill SF 985, which is currently included in today's discussion on appropriations. 2 years ago, I contracted bacterial meningitis and spent 31 days in the hospital. Meningitis initially left me paralyzed on my predominantly left side, but I spent the last 2 years rehabbing 4+ hours a week to regain use of my arm and hand and relearning how to walk. Additionally, 18 months ago, my 15-year-old daughter was diagnosed with POTS, which stands for postural orthostatic tachycardia syndrome. Briefly, POTS is an autonomic disease that affects the heart, brain, and nervous system. Prior to her diagnosis, she was a competitive varsity softball player on track to play D1 softball. Since her diagnosis, she has become homebound and attends school online and has become forced to give up playing softball. This bill would ensure that people like us would be afforded the same equal rights as our able-bodied neighbors. However, I've been quietly advocating for the past 22 years as my oldest daughter was diagnosed with juvenile psoriatic rheumatoid arthritis at 18 months old and continues to live with this incurable disease into her adulthood. I learned early on I had to be her biggest advocate to ensure that she received the best treatment she needed from the insurance companies, her medical team, inside the classroom, even within her community. I've spent hours both here and in Washington fighting for her, and I'm prepared to do it again, but this time both for my daughter and myself. There are simply not enough resources available to people that have a disability. I'm here today to remind you that even though my family has experienced disabilities in childhood and early adulthood, statistically speaking, everyone in this room will experience a disability within their lifetime. I want to thank Senator May Quaid, Senator Abler, and Senator Hoffman for all your work you have done to move this bill forward. I'm asking you to please keep the asked one-time appropriation of $4 million in the bill and say yes to becoming champions for disability inclusion in the state of Minnesota.
Thank you very much. I appreciate that. So we got Ms. Hoopert, Mr. Burnt, and then Ms. What is she? Ms. Commissioner Senator Clark. Anyway, if you're here, you can come down. So go ahead. Welcome, Mr. Burnt.
Thank you, Mr. Chair and members of the committee. My name is Kyle Burnt. I am here today on behalf of the Long-Term Care Imperative in opposition to Senate File 3054. We appreciate that there are difficult decisions for the chair and the committee to consider when developing a budget with a negative target. While the governor's proposal included a larger overall reduction, we are disappointed that the nursing facility cuts account for $192 million or 27% of the Senate Human Services budget cuts. By contrast, the governor's plan cuts $220 million from nursing facilities and about 13% of his total proposed cuts. The proposal as drafted with a 4% cap will punish providers who last year made good faith investments in their workers and the workers' pay and benefits on the assumption that VBR system would provide reimbursements for those costs. One operator highlighted to me that they expected somewhere between 10 to 15% rate increase due to the higher wages that they tried to get ahead of before the effective date of January 1st, 2026 for the Nursing Home Workforce Standards Board. From this 4% cap, they would see a loss of the 6 to 11% additional reimbursement they had expected. However, many facilities were not in a position to make these sorts of investments. It's a kind of a unique situation that they had, which is why we were disappointed that there was no upfront funding for the costs associated with the board's mandates. We believe the Nursing Home Workforce Standards Board is fundamentally flawed in its construction, as mandates enacted by the board require nursing facilities to reallocate other resources, spend down reserves, or incur debt to cover costs until they are reflected in VBR rates 18 to 21 months later. Instead, the legislature should require that these mandates be forecasted independently, separately from the current forecast system that we use for each individual facility. With that, I'll turn it over to my colleague.
Ms. Hooper.
Thank you, Mr. Chair, members of the committee. For the record, my name is Erin Hupert, and I am also here on behalf of the Long-Term Care Imperative. So to draw your attention to a few provisions in the delete everything, we have a few questions about the methodology for the new upper limit formula for the total care-related payments, which I believe is in Article 1, Section 17. Since this wasn't a legislative proposal with a fiscal note, we are still working to understand the impact on facilities. However, our preliminary analysis suggests that the language has some pretty significant consequences. So take, for example, a real but unidentified nursing facility with a quality score of 78. Their 2025 care-related per diem based on their 2023 cost report is $268.38. So under current law, this would set their care-related limit at $279.06, which means they would not be subject to a limit or a cap. However, under the Senate's language, they would lose $24.58 per day, which is the equivalent of a 9% cut. So given they have a relatively good quality score of 78, we do have to wonder how the provision in the Senate position incentivizes quality improvement, as it was described that it would do earlier this week. Additionally, the language would require that 9% cut to that one facility would be in addition to limiting their other operating costs to 4%, regardless of the expenses that they incurred in 2023.
Why don't you take it back then?
We do appreciate funding for the CANF program. In the most recent application cycle, over 80 facilities applied, with about 30 receiving funding. So we believe this perhaps suggests that rural access to care and interest in nursing facilities funding is a symptom of a problem and not a solution to one. We do appreciate the continued discussion on resident safety in assisted living facilities and look forward to more dialogue with stakeholders as this moves forward. And finally, I will conclude with saying that for months we have shared this committee's opposition to the governor's proposed Medicaid caps. But the nursing home cuts in the proposed bill before us are very troubling. And so as this moves forward to the floor and into conference committee, we look forward to working with you to ensure that Minnesota seniors can have access to the care that they are entitled to. Thank you.
Senator Rasmussen.
Thank you, Mr. Chair. A question for the long-term care imperative, and I think maybe this figure was mentioned, but I just want to make sure I understand. So in the bill before us, when you guys look at the total fiscal impact on Minnesota's nursing homes, long-term care providers, what is that?
Ms. Huppert.
Mr. Brent.
92 million.
Mr. Burnt.
Mr. Chair, Senator, looks like a $192 million cut.
Can you rephrase that again? Just so did you say 119?
192 million.
192 or 119? I missed.
192. 92.
Okay.
Thank you, Mr. Chair.
Senator. Senator McQuaid.
Thank you, Mr. Chair. Since we're asking questions, we were having a conversation on the floor earlier today, and we had different numbers in our head, and I think that you both can answer them. Will you tell me the number of people who are in long-term care in Minnesota?
Ms. Hubert or Mr. Burnt? We were having that same,
and we
just had this conversation.
Yes, and we said different numbers, and now I feel like I don't know.
Do you guys know?
Mr. Chair, Senator McQuaid, we probably should follow up and get you accurate answers. Just to be clear for what you're looking for, do you want assisted living, home and community-based settings, and skilled nursing, or just one of those in particular?
Senator McQuaid.
Thank you, Mr. Chair. I think it's just skilled nursing. And does 11,000 sound right to you, or does 17,000 sound right to you?
There's a bet on this, by the way.
It's a lot of money.
We're talking
$2 billion.
Elise Bailey knows the answer. She's
11,000?
it's less. She won that.
Thank you. Oh, no, we just have $2 billion between us. It's a totally personal bribe with our own money.
I have no idea. This is like, you know.
I thank you.
Thank you, Senator McQuaid. Thank you, three. Madam Commissioner. Actually, it should be Senator Commissioner. How do you get announced now? I mean, I've always asked that, and
it depends upon who's talking to me, Mr. Chair. I suppose some people have other names.
They just say Terrell.
I think Terrell is what I usually encourage people just to say. Terrell works best. I think you're right, Senator Abler. Although former Senator Betzel used to say the reason why senators always refer to themselves as senator
is
then they don't have to remember each other's names. Okay. Mr. Chair and members, I'm Terrell Clark. I'm a Stearns County Commissioner. I really appreciate your opportunity to testify this afternoon. I think you know that I'm here testifying on behalf of the Association of Minnesota Counties and the Minnesota Inter-County Association. I think part of what I'm...
Stacy, come on up.
Yeah.
I see you.
I was going to say, I'm going to refer to Stacy in 2 sentences. So, as counties, we recognize the challenges that you're facing right now. This is hard stuff. You all are working really hard to try to figure out how to continue great and important services around the state, meet people's needs, and balance the budget. I'm here with my colleague, Stacy Hennon, who will talk a bit more in depth on a couple items that I will mention. First off, this is the thank you. Thank you for the inclusion of the Min Choices measures to simplify the assessments. It's been a priority for years. It's going to make a difference for families, for those individuals, and it will free up time to actually help other individuals. I will say, though, that the rest of my testimony is a little more grim. I hope you'll receive it in the spirit and how it's intended. Counties are partners with the state in developing solutions to our shared budgetary concerns. As elected officials, we are careful stewards of public dollars and need to weigh that against our priorities for a healthy environment, strong business development, and very importantly, protecting our most vulnerable residents. We too, as counties, must balance our budget, and we have nowhere to shift any other costs. I'd like to highlight the significant cost shifts in this bill and talk about them not just as cost shifts that may look like savings to the state, but rather as local property tax increases that will negatively impact all of our constituents. I do want to start with thank you, though, in that regard. Thank you for not taking the governor's lead on several inappropriate shifts to property taxpayers, including the proposed increase to the county cost share for the Minnesota Sex Offender Program and proposed increase to the county cost share related to the Behavioral Health Fund. I know Stacy's going to refer to a couple other things. I also, not surprisingly, want to mention the priority admissions work. Obviously, I've been in front of this committee several times this year talking about this. We appreciate the good, thoughtful work and conversations. Unfortunately, this bill, probably because of the target, doesn't include those recommendations, and in fact, county taxpayers are going to have to pick up more of the cost. We're concerned by the additional costs outlined in Article 6, Sections 2 to 3 related to voluntary admissions or commitments under Chapter 611. Current statute doesn't create a county cost obligation. Counties support the use of Chapter 611 as an alternative to commitment. However, County Human Services cannot bear the weight of this cost, which is projected to be $16.8 million per biennia. And if I might say, I found this section very confusing to read as an attorney, so it might need some simpler language. Although Ms. Bailey did manage to figure out it would cost almost $17 million each biennia. I want to remind the committee that there's a hidden cost increase not reflected in this bill. In 2024, the does not meet medical criteria cost paid by counties was $24 million. You've heard us talk about the inappropriateness of counties paying these cost shares when individuals are waiting transfer between state-operated facilities. The legislature granted us a 2-year reprieve on some of those costs, saving counties $10.2 million alone in 2024. The reprieve is set to expire in July. Without action by the legislature this year, this cost caused by the lack of capacity at DCT will again inappropriately be shifted to property taxpayers. These charges can bankrupt a county's behavioral health budget and are outside a county's control or ability to avoid. We appreciate the work of this committee to address this for several counties in the past, but this cost shift is a burden to all county taxpayers. I'll close my testimony, Mr. Chair and members, by just asking you to add up the dollars and purported savings in this budget spreadsheet. Those might be state savings, but the need for the services and the mandate for the services do not go away. They will simply be picked up elsewhere, mostly by county taxpayers. As a commissioner evaluating your decisions to assess what impact they may have on my county, I can unequivocally say that the budget before you would force counties like mine to again go to local taxpayers and increase their property taxes, something that is, as you know, very hard to do and impossible in some places. I offer myself and my colleagues, though, as partners in this work as the bill moves forward. We want to keep working to find solutions and work together getting through these challenging times. Thank you, Mr. Chair.
Thank you, Charles. Stacey Hennon.
Good afternoon, Mr. Chair, committee members. Thank you for the opportunity to testify this afternoon. I'm Stacey Hennon, the Executive Director of Western Prairie Human Services, which serves Grant and Pope County and Traverse County, and I'm here today representing MAXA. I'd like to underscore the comments of Commissioner Clark and express our commitment to working with you as the bill moves forward to make sure that it reflects our shared priorities and person-centered care and access to quality, cost-effective services. I do want to thank the Chair for including our MAXA priority on MnChoice's reassessments. The provisions in this bill streamline the MnChoice's tool, which county workers navigate daily, making it a top priority for all counties, allowing for less involved reassessments for individuals whose situations remain unchanged for year after year, expanding the use of technology to conduct reassessments, and permitting verbal attestations from those we serve will significantly improve efficiency. This will also free up county staff and ease the enormous backlog of people waiting for initial reassessments. As Commissioner Clark noted, we are appreciative that this proposal does not include the more egregious cost shifts of the Governor and House proposals, but we must express concerns with the 2% county cost share for select waivered services. This is a shift of $33.6 million next biennium that grows into the future and disproportionately impacts seniors and low-income taxpayers in the form of tax increases. I also want to touch on the behavioral health fund issue that Commissioner Clark mentioned. We appreciate the policy direction in Article 3 proposed by the Governor to move substance use disorder eligibility determinations to the state level. While we're skeptical of the ability of DHS to do these determinations with limited staff, it makes public policy sense for counties to be removed from the role, as we no longer do comprehensive assessments or care coordination with the state's move to direct access. However, we must highlight that despite no longer having a role in eligibility determinations or comprehensive assessments, counties still pay up to a 22.95 share in the Behavioral Health Fund. So while we appreciate this committee not moving in the opposite direction and increasing the cost share, we'd like to talk in future sessions about eliminating that existing share altogether. Second, I want to flag some concerns with Article 2, Section 8 regarding out-of-home respite. We'll work with the original bill author and others on this topic to ensure the most appropriate county staff are conducting site reviews and that the language explicitly prevents a practice we have seen on the adult side of our work with organizations purchasing homes and misrepresenting the ability of the home to provide services and supports. Chair Hoffman and committee members, please see counties as partners and a resource in these conversations. Thank you for your time, and I'm happy to answer questions.
Thank you. Senator Rasmussen.
Thank you, Mr. Chair. And question for Ms. Hennon or Commissioner Clark. Do you know, in terms of the county cost shifts included in this bill, do you have an estimate of what this would mean for property taxpayers in your area? Have you had a chance to take a look at those numbers or have any estimate for what that could look like?
Stacy gave us that one when she first, remember that? Remember when you were looking at it?
It was really powerful.
How many people live in your county, Stacy?
Traverse County has 3,136. Grant County has 6,139. Pope County has 11,400. And I know the households too, because Senator Rasmussen is extremely inquisitive.
Senator Rasmussen.
Thank you, Mr. Chair. And Ms. Hennon, do you know, for these counties, what this could mean in terms of property tax increases for them, or do you have any estimate?
So
Thank you, Senator Rasmussen. We don't have the estimate yet because the bill just came out. I can tell you that we anticipate, if you look at the waiver care going from 5% to 2%, I think our Traverse County, our waiver increases will still be around $75,000, which is still pretty high. And then for Grant and Pope County, we're still looking at probably 175, maybe 200,000 when I look at it. I have to get the numbers exactly though. I do know that Max and AMC will be getting those numbers together, and we'll be looking at all three proposals together and trying to get some comparisons together.
That was Senator Abler.
All right. Well, thanks, and I appreciate that. And just trying to give credit where it's due, I believe that this bill has the least amount of impact in a goal where we'd like to have zero. But I'm curious, the other body came out with a thing which I find unimaginable, but I'd like to know that total sometime too. I mentioned to the commissioner when she was here that I think 460 million, and even the numbers in this bill are difficult and actually not a good idea, especially given we don't know what the impact might be. And you can absorb these, but what happens if another round comes? Thank you.
Thank you, Mr. Chair. So for Stearns County, we anticipated the 5% shift on the DD waiver to Stearns County would be roughly 5 million, so it would be roughly 2 million. And we know that's just one of them. I will personally say, very much appreciate the hard work you've done to try to figure out how to come off of where the governor's proposal is. This bill, though, would still necessitate some tax increases that you all couldn't pass through your bodies, right? I mean, like it just couldn't happen, and we're going to basically have to do it, which ought to be a very interesting thing, unless language changes about services too, right?
Go ahead, say it.
But we are going to keep working with you on it. We want to do that. We can give you a better sense of what this all means as we're going through. And it really is, we've got this braided system, right, of how we're paying for and serving, and how you've been so thoughtful about the significant means some Minnesotans have. And then we have the other piece of it too, that some of those same Minnesotans can't afford to pay the property taxes that will get put on them to help cover those services.
Terrell, you ever go to a football game?
Yes, and Mr. Chair, I should probably tell you, I hope y'all won't get in trouble, but only people who pay me at least 7 digits get to call me Terrell, because it's Terrell.
I know, I said that.
I know, but on purpose. I need to be like paid like a basketball player or a football player.
Terrell.
I know.
Madam Commissioner, there, I'm going to be formal.
No, you don't.
Do you ever go to a football game?
Yes, lots of times.
Like in the big, what is that place called? The Superdome, or what do we call it? No, we call it the US Bank.
You mean the Metrodome before?
The US Bank Stadium?
Yes, I have.
And you sit in a chair?
Yes.
And you look at the ticket that you purchased in that chair? Did you see that? There's a tax you pay on that, right? Did you know there's the suites that are up there? Senator May Quaid, there's the suites up there. It's $9 million a year. They used to pay taxes on the people that own the suites. $9 million per year for the last 10 years. They have not paid taxes on the same seats that you have to pay taxes on. Just my point, senators. I'm just laying it out there. So, Senator Rasmussen.
Thank you, Mr. Chair. And I'm just glad that we're able to talk about things that are outside of the committee's jurisdiction when it talks about financial trade-offs. So, thank you, Mr. Chair.
Senator May Quaid was lifting up her tabbed book. Senator Abler, then
those like
Aaron.
equity investors up there, do you think? Maybe doing that?
I don't, yes, private equity investors.
Mr. Chair, along the levity lines, I took our granddaughter first to see the Nutcracker a couple years ago.
Yeah.
And the fees that we would have paid were more than what the ticket was.
Isn't that something?
And it was like, help me understand this. If we could figure out how to nab some of those fees, maybe there'd be another solution.
Senator May Quaid, to that point.
Thank you, Mr. Chair, and thank you, Commissioner Clark. I have been working on trying to figure out how one would capture fees on that, something in the Education Committee with Senator Gustafson. So
I just kind of look from Senator, we're not going to go down that road, to Senator Rasmussen's point. Thank you for talking about something. I needed some brevity in this conversation today because it's real stuff. So thank you two very much. You want to go, John, thank you too. John Sundergaard, Olga Shavaleva, and Phoebe Trepp. You want to come up? How was the commute in, John?
Took longer than normal, but
Nice to see you again.
nice to see you.
I still got to come see you in Brooklyn Park. And I will, I promise you. When this is done next week, I'm coming to see you.
Sounds perfect.
Thank you. Go ahead, John.
Good afternoon, Chair Hoffman, members of the committee. My name is John Sondergaard. I serve as a board member of the Residential Providers Association of Minnesota. RPMN, we represent small community-based customized living and waiver service providers throughout the state. Our organization provides essential services to some of Minnesota's most vulnerable. On behalf of RPMN, I want to thank you for including several of RPMN's top priorities in Senate File 3054. We appreciate the fund that will, funds that will, the bill that will support efforts to improve the DWRS cost reporting process and align the customized living rate framework with the costs associated with operating a licensed assisted living building. RPMN appreciates the temporary moratorium on new ICS settings and language directing DHS to make recommendations on how to create a provisional ICS licensing process. We respectfully request additional language directing DHS to use this period to clear the backlog and issue quarterly reports on capacity, utilization, and wait times. Lastly, we'd like to thank you for the work on the termination reform in assisted living settings, an issue that deserves thoughtful collaboration with all stakeholders. We know the language in the bill is still very much a work in progress, and we are committed to continuing discussions with stakeholders, and so we can identify areas of agreement and compromise before this bill reaches the Senate Finance Committee. With respect to larger finance components, RPMN appreciates the committee not including the governor's proposal to prohibit CADI and BI recipients under the age of 55 from accessing customized living settings. We do, however, want to highlight a few concerns. The first is the proposed changes to CADI BI eligibility tied to homelessness and hospital readmission risk. Those are not quite clear to us, and we're eager to better understand the potential impacts of those. And while we're relieved there's no cap on DWRS adjustments, we are cautious about the shift to a CPI-based inflation formula, which may not keep pace with the true cost for providers. In closing, thank you for listening, for including RPMN's voice in this process and your dedication to individuals with disabilities across Minnesota. We look forward to continuing to work with you as the bills move forward.
Thanks, John. Looking forward to your partnership on that. So, Olga.
Chair Hoffman and committee members, my name is Olga Sheveleva. I'm the VP of Development and Strategic Planning for Metropolitan Community Services. I'm speaking today on behalf of the Minnesota First Provider Alliance. We want to express our enthusiastic support for 3 provisions in Senate File 3054. First, the Provider Alliance strongly supports the language for which would allow for the delivery of CFSS services during the acute care stay in a hospital. This is not only person-centered, but it is a potentially cost-saving proposal that could reduce rehospitalizations and therefore high medical costs because CFSS workers can support service recipients in the transition back home. Second, the Provider Alliance strongly supports the increase in the enhanced rate for PCA and CFSS from 7.5% to 12.5%. Increasing the enhanced rate will ensure people with disabilities, especially those with high support needs, can attract and retain staff and therefore maintain their choice of living in their communities. And lastly, and the one that I would like to spend the most time highlighting, the Provider Alliance strongly supports the elimination of the training requirements for workers to access the enhanced rate. The training requirements have been a barrier to access due to language barriers, the time it takes to complete the training, technology barriers, and the geographic availability of the training, especially in Greater Minnesota. In fact, in the fiscal note for Senate File 815, where this language originates, an estimated 88.7% of paid claims eligible for the enhanced rate are in fact paid as at the normal PCA rate instead of the enhanced rate. That means that only about 12% of people eligible for the enhanced rate are actually receiving the enhanced rate. We firmly believe that barriers like the training requirement are a contributor to the slow utilization, and this justifies the need to remove this barrier so that if someone is eligible for the enhanced rate, their worker automatically receives the enhanced rate. As previously stated, this change in conjunction with the enhanced rate increase will especially help people with high support needs in their efforts to attract and retain staff. Thank you for your time today, and thank you for the important work you do in this committee.
Thank you for so much. Phoebe Trepp.
Hello, Chair Hoffman and members of the committee. My name is Phoebe Tripp. I'm the Executive Director at Clare Housing, and we are the largest provider of housing with services to people living with HIV in Minnesota. And I'm here to explicitly thank you for your work to support people living with disabilities no matter their age. We provide customized living to people in permanent, supportive, deeply affordable settings where the vast majority of clients are under age 55. HIV is just one of the multiple conditions that our customized living clients are trying to manage, and customized living is currently the only service that we can use to provide nursing on a daily basis to our clients. Our nurses manage diabetes, COPD, provide wound care, and oversee complicated medication regimes. Some of our clients take 50, that is true, literally 50 medications on a daily basis or a weekly basis. HIV is drug resistant in some people, and treatment courses can change multiple times in efforts to reach undetectable viral loads. This is just a quick picture of one example of one of our clients' active medications. This is only 33 compared to some 50 that some take. All this is to say thank you so much to Hoffman, Senator Abler, other members of this committee for caring about the people we serve and continuing to do this long, hard work in sorting out how to balance services and expenses. We are with you in the search for improvements while not sacrificing health and ultimately the lives of people living with HIV who are under age 55. I recently ran into a client who moved into Clare Apartments when he was in his 30s. He's been at Clare for 20 years now and shared when he moved in he didn't expect to live more than a year or two. He was no less than amazed to be alive. On behalf of him and others we serve, thank you so much for doing this hard work day in and day out. Thanks.
Thank you for your mission, Phoebe. Sean Burke, Sarah Grafstrom, you guys want to come on up and... I think that just about does it.
Mr. Chair, members of the committee, my name is Sean Burke. I'm with O'Connell Consulting, testifying today on behalf of the Minnesota Consortium of Citizens with Disabilities, also known as CCD. Our members are self-advocates. They're disability provider organizations. They're legal and other advocacy organizations working to improve the lives of people with disabilities. For the sake of time, I want to highlight just two specific areas of caution, areas where we might need some guardrail language if certain cuts remain in this bill. The first is the county cost share of the 2%, Article 2, Section 22. Going back to county cost sharing is tempting in times of tight budgets, but it could have the effect of exacerbating regional, geographic, and racial disparities. Over a decade ago, the state had to defend litigation over county cost share tools in other parts of our waiver system. We applaud that this bill rejects nearly all of the county sharing tools proposed in the governor's budget, except for the 2% across the board policy. So if this cost share remains in the bill, we recommend guardrails to ensure that counties are fair and are not rationing any care based on fear of county increases. There is some additional DHS oversight that could be added to this bill. We look forward to working on possible language in this area. The other issue are changes to the CADI and BI eligibility. This is Article 2, Section 15. To the extent that this provision moves forward, we strongly encourage the following. First, clarify that it only applies to new determinations and not redeterminations. And then if it applies to redeterminations, add an amendment to protect due process of individuals. There should be specific directions to lead agencies to explain why they're being cut. There should be an extension to the amount of time they have to an appeal, and they need to be listed all their other housing options if they do lose their CADI waiver or BI waiver. We recognize this is difficult decisions have to be made, and appreciate that this is the start of a process and look forward to collaboration. Thanks.
Sean, you have written that up too, and you're working still in conjunction, I would assume, because remember, we all left here, even on the policy side, you're working in conjunction, and Susie Scheller, everybody's working in conjunction with long-term care imperative too. I see that we're about 75% done on something, so appreciate your work, Sean. Thank you. Sarah.
Chair Hoffman and members of the Human Service Committee, for the record, my name is Sarah Grafstrom. I'm here today representing ARM and our over 230 disability waiver service providers. Thank you for the opportunity to testify to the Senate Human Service Omnibus Bill. I want to start by taking this opportunity to thank the chair and committee members for your work this session and the thoughtful discussion that has occurred around disability waiver services. So to the bill, first I want to thank the chair for including our proposal to expand out-of-home respite for children. This proposal is important for families across the state to have access to safe, trusted respite options in their community. And while it is not reflected in the fiscal note, we truly believe that having respite options for families saves the state money in the long run.
Do you have an UFTA in here, Sarah?
Maybe, if I go on long enough, I'll give you an UFTA and a you betcha.
I'm kidding.
Now I'm all flustered. All right. I also want to highlight the funding for the technology education grants. Assistive technology and remote support are critical keys to the workforce shortage, and we are excited about the opportunities that come with increased education on the various technology options available to people with disabilities. And I want to thank the chairs for including the funding for the financially distressed family residential service provider grants. Moving to the new rate tiers in 2026 will jeopardize the future of these services, and we are thankful for the funding to support service providers in the transition and hope to work with the legislature in the future to find a permanent solution for these important services. Turning to the changes proposed to the disability waiver rate system, I want to start by thanking the chair for the adjustments to the competitive workforce factor and continuing to invest in wages for direct support professionals as a top priority. We are happy to see these adjustments included, and we also want to thank the chair for not including a cap on the future inflationary adjustments. Finally, I want to draw attention to the changes being proposed in Article 2, Section 35. This section sets limits on rate exceptions and creates new criteria for what rate exceptions can be requested for. Rate exceptions were established to support individuals with exceptional needs, creating limitations on the size and number of rate exceptions, as well as limiting the use of rate exceptions, is not person-centered and takes away from the original intent of establishing a way for everyone's needs to be met through the DWRS. We are hopeful that we can continue to work on this section of the bill to develop thoughtful parameters that do not keep individuals from accessing the services and resources that they need. With that, Mr. Chair and committee members, as we continue to go through the legislative session, ARM and our members are ready to partner with you in ensuring that services that support people with disabilities are a priority, not only for this committee, but for your legislative colleagues. Thank you.
Thank you. I have nobody else on the list. So with that, members, comments, or do you want to go right into the amendments? We have this room until 10 o'clock, so you guys, if you want to spend the next 5 hours. No, I don't make as much money as you. You get to buy dinner. I'll buy dinner. I'm kidding. We have it till 7, Paul, so we're good.
Mr. Chair.
Senator Abler.
Well, just briefly, and while you were out, I suggested to the testifiers, you have a deck of letters there, but having sat in your, I was actually talking to you.
They asked me if we adopted the AA before testimony, and and unequivocally had to say yes. So I got pulled that direction. So I'm sorry, Senator. You go ahead.
You get more distracted than I do.
You know what? This gets me. We wait till the last minute on these gall darn amendments, you know, and now we're sitting here, and it's flustered. This is the first time in all my years of working with you. How many years have we been on this committee together, Senator?
50.
Yeah. Tonight, I have to tell you, I've never seen it so unorganized getting us amendments, and that's our fault. Our committee stuff.
I usually blame the chair for that.
You blame me. I'm absolutely going to take that. But so I'm sorry if I got sidetracked because I was like listening to the question that was in. So we already adopted the A8 amendment. So I wasn't listening. Now, Senator Abler, I am fully listening.
Thank you. Anyway, while you were gone, putting out fires, I suggested to the testifiers, some had very complex suggestions. I thought they were really good. But we're all busy, distracted. But I just suggested to them as this going forward, if they would even, we get so many emails, but maybe they should even give you like a handwritten thing with circle parts and like put a star by things that they could do better. And that would actually would be how I would do it, or they could, however electronically you're inclined. But because this, and I told them this is like a really hard job that you have, and the pressures and the emotional parts. everybody who's here, you and I agree, we would not want to do any of those things that happen to us. And so how do we make it go better, particularly facing that this is, of the 3 choices available to us, the best version, Mr. Chair. But still, it's not as satisfactory as we'd like it to be. And so with help from the department and MMB and the clever fiscal people, if we can actually get more comprehensive fiscal notes, we can actually reform things, do it better, and actually have minimal impact. But I just wanted to remind that, so I was just going to suggest that, and so that they should give it to both you and Mr. Zach. So anyway, just one thing occurred to me on this nursing home business. As people are, they have this 2-year delay. So in a number of parts, I just wasn't aware until I was talking to people today, like when we put a cap on it, it caps the money they already spent. So if there's some way, if we're going to do a cap, to put it out a year or something, so if that would be the better of horrible choices. But also on the Nursing Home Standards Board rate increases, or wage increases, they get paid for 2 years later as well. So where the department says, oh, there's money and they're paid for, there's actually a delay. I just wanted to. So I don't know, that's an interesting, I hadn't thought of till today, so thank you.
You used to talk about delays, Jim, as if I delay this, then what would have been spent it's captured, I can capture that bit of money. Is this the same argument? If you would one articulate in a fiscal sense, we're all assuming, right? These are all forecasted dollars. Are you capturing the savings the same? Could you capture the savings the same way?
No, Mr. Chair, this actually costs money because if you're going to do a nursing home cap, which none of us like the idea, but 4 is better than 2.
Yeah.
And I think everybody agrees on just on this single element. But if you delay it 2 years, you don't get as much savings. It's in the details. But at least that way you don't ruin people's lives in the meantime that have already spent the money.
I like where you're going with that.
Anyway, that's just a thought. And
do you have time? Is that something that
we should do amendments probably now? But
all right, let's do this, Senator. If you look, there's some technical changes that we had to get through. So members, the A2 amendment is in front of you. Well, will be. They're bringing it out right now. Remember, our staff had to do the technical changes from the department. The A2 reflects that. Any questions, comments? This is the shortest technical change fix I've ever seen, Mr. Monahan. From the department. Christy, do you need to come down and tell us what you're fixing here, or is it pretty self-explanatory? To me it is, but she's got her thumbs up. All those in favor of the A2 indicate by saying aye. Aye. Opposed, same sign. Thank you. The other one, as we're going to hand out, is the A15, which is the base rider article, Senator Abler. This one just allows that the legislature, a firm decision about new spending and what's in the base. All other budget areas outside of human services and HHS do this already. It's a common practice, Senator Abler. It's my amendment, but this is what you've been talking about forever.
Well, Mr. Chair, there's common practice and good practice, so we don't just want to go along with the crowd, do we? Thank you.
All those in favor of the A15 say aye. Oh, I'm sorry. Somebody needs to move. Senator Abler moves the A15 amendment. It's just what it does is it's the transparency we talk about. It's a base rider article. What it does is it allows the legislature the firm decision about what new spending and what's in the base. We always talk about, Senator Utke, well, what's in the base? It's like, so we're trying to get this, all other budget areas outside of our, do it. So it's common practice. Then Abler said, what's common practice isn't necessarily, what was the word you used?
Mr. Chair, it's known as transparency.
Thank you, Senator Utke. Senator Abler moves the A15. All those in favor say aye. Aye. Opposed, same sign. Thank you. Next one coming out is the A32. Senate File 3352 and Senate File 2542, as amended, are moved into our bill. What that does is it's being passed out, members. It's the repealer. It repeals that 2023 provider premium provision, and then it cancels the appropriation for the safe recovery sites, and then 1 million transfers back to the general fund. Senator Utke, you want to move that?
Mr. Chair, I have a question.
Just go ahead, Senator Rasmussen.
Mr. Chair, I was wondering if Senate Council, I'm just looking at page 7, subdivision 15, if they could explain what we're doing here, where this language is coming from.
Mr. Monahan.
Mr. Chair, Senator Rasmussen, this language is from Senate File 2542. It had to do with enteral nutrition. It was heard in committee and amended. DHS has indicated that the language, how did they describe it? Unquantifiable, I believe, was the expression. And therefore, we can book it as a zero cost.
Isn't that cool? Senator Abler.
Well, Mr. Chair, we should have had this one on February 2nd. How many years have we been working on this thing? I mean, a ridiculous amount. Thank you for whoever put this together. Thank you.
When was, in the other body, there was a certain state rep named Nick Zerwas, so it's 20, I want to say 2016, even before then, Senator. 17. Senator McQuaid is saying, yeah.
It's defied resolution. Is this the Winslow Chamberlain peace in our time? This is it? We got it?
We finally got it. Senator Rasmussen.
I guess, and maybe I could ask Mr. Monahan this, could you just describe what this amendment does, and especially since we have repealers in here and we don't have the deleted language, just I want to make sure we understand what's in front of the committee.
Sure. Senator, Mr. Monahan.
Mr. Chair, Senator Rasmussen, so when you look at the repealer, the paragraph A is already in the underlying amendment, the A8, but for technical reasons, if we change a rider, we have to delete the entire rider and insert it with the new language.
Get that.
So paragraph B is the only portion that is new, and that is repealing the section from the Family Medical Leave Bill of 2023 that set aside $20 million to cover the costs for direct care providers' premiums.
Mr. Chair, the one point I wanted to add on to what Mr. Monahan just said. So this, that change in particular reflects what I went over yesterday on the spreadsheet. So this is an amendment to reflect the changes on the spreadsheet that was presented before the committee on Monday, excuse me.
Senator Rasmussen moves the A32. All those in favor say aye. Aye. Opposed, same sign. There you go. I got Senator Abler. You got the A4, or should I go to my favorite song, the Hey 19, and go to Utke? What do you want to do? I think the A4. I got this list. You want me to just go down the list, or you guys feel like, all right? Senator Abler. It's your waiver reimagine. It's that edit to the nursing provisions. We all love that. We all love you. What you did is good stuff. Thank you, Senator Abler. Mr. Monahan, this, could you?
It's a very necessary amendment, so thank you.
And you know what's amazing is I got lost in all the emails that were going, does this fix it? It was like, no, this
We had
fixes
testimony,
it.
there were people wanting this amendment.
Yes.
While you were out there, were like people like, this is probably the most popular amendment of the day in terms of audience participation. Thank you, Mr. Chair.
Mr. Monahan, will you explain to the good senator from Anoka what we're doing in here finally?
Mr. Chair, Senator Abler, in the underlying A8, there is language to add a process by which the individual budgets under waiver reimagine will account for home care nursing. The language, however, didn't specify that the home care nursing could be self-directed. So that's what's happening on 1.3, specifying that it can be self-directed. The next change just specifies that I'm sorry, it's been a long day. The assessment that results in somebody being authorized to have home care nursing, part of the process involves a form that is filled out by a primary care provider. 1.7 includes a second budget tier under waiver reimagine that the advocates felt was important to be included. And then the rest of the changes are related to the issue of self-directing home care nursing.
Senator Abler.
Very nice. This could just be the WARE amendment, Mr. Chair. It's W-A-R-E. And,
Senator Abler.
Urgent support.
Moves
Adoption.
the A4 amendment. All those in favor say aye. Aye. Opposed, same sign. Thank you. Nice work, everybody. I saw the multiple. Everybody was included. I saw those. Nice job. Senator Abler got the A20, which disproportionate share. You look at, when you did that, conducting a study of the impact of the rate floor payments. So that amendment's in front of us. Do you want to talk about that at all? Or?
Chair, I believe, Mr. Monahan, this actually restores the program. Is that right? It's just, what's it, a study? Oh, okay. Okay. I gave up on restoring. I'm not done with restoring the program, Mr. Chair, but this proportionate share is actually one of the success stories of coming out of the Senate. And unfortunately, even with all the rate changes and increases that have gone there are a number of places that have 80% or more individuals on the elderly waiver and other waiver programs. And they just deserve a special place in heaven, because some other places, Mr. Chair, have like 2 beds per 100. And I don't know what's going to happen to them, but that's a different discussion. But so it's really a problem, really a problem. And so this amendment is trying to at least, put a marker down, like, couldn't we just do something? And so we asked the commissioner to actually, we've been kind of led to believe everything is going to be fine. But if I talk to the providers who are doing in this category, everything's not fine. So maybe if we can ask them to look at it, they'll agree it's not fine, and we can fix it. So that's the amendment, Mr. Chair.
And this, Senator Abler, I remember last year, 2 years ago, the conversation out in Wright County, Minnesota, there in Buffalo, there was like 83%. I mean, some of those that you're getting at. So thank you for working that. Anybody else to Senator Abler's point? EMQ? Sorry, Senator McQuaid.
Thank you, Mr. Chair. It might just be the sheer amount of paper. Senator Abler, will you just remind me what this is? I'm sorry.
Oh, yeah, sure. So there's a rate for elderly waiver, and then some people have a higher percentage, and so the regular rate is insufficient. And there's quite a bit of variation in those rates, some ridiculously low depending upon any number of factors. And the thing was that when it's fully funded, it's going to go away, but it's 2018 rates, as I understand it. So it's some places are at risk of not even staying in business if they lose this. This takes effect January 1st. 26, and if Mr. Monahan wants anything else, you don't have to say anything else. But if that's close enough, I'll just let you nod and like, no, that's good for now. Is that clear enough? I can talk more about it, but okay. Mr. Chair, I hope, I have to shoot high, but it would be nice if we could get this back by the time we're out of here. So that's one of my just personal goals. So, but this discussion about it now is a good start and makes a placeholder. Thank you.
Appreciate your work on this, members. Senator Abler moves the A20 amendment. All those in favor say aye. Aye. Opposed, same sign. Senator Abler, the A26. We have had some conversation. Senator Utke knows this conversation as well. The A26 is regarding some civil commitment changes that need to occur that Senator Abler is bringing for us, and it fits within our jurisdiction. So, Senator Abler, you want to talk about those?
Well, Mr. Chair, yeah, we've done a lot of discussions about civil commitment and 48-hour rules, and sometimes it doesn't go right. And so there's already a task force or working group or something, and so how do you get a person out of this category if they really never should have been there in the first place? And so we're asking this group to talk about it and see if there's just some way to undo the harm. And if you're wrongly committed, which then becomes a nightmare, becomes catch-22. If you insist while you're there that you shouldn't be there, then you're a problem person. And if you remember the real catch-22, if you're mentally ill, you can go home, but if you want to go home, then you can't be mentally ill. So that's the catch-22 from the Korean War, but the movie, which was pretty amazing. But this is, I ran into at least 2 people who have struggled with this, and this is an effort to try to create an answer to that going forward. It doesn't solve it, but it has this group to actually look into it and see what might be the reasonable path forward. So thank you.
Totally makes sense. Senator Rasmussen.
Thank you, Mr. Chair. And I just want to make sure I understand. So this would be adding new duties to the mentally ill and dangerous civil commitment reform task force. Is that an active task force, Mr. Chair? Do we know? Does Senator Abler know?
Mr. Monahan.
Mr. Monahan, is that still an active one? I think it is.
It looks like, Mr. Chair, I'm looking at page 2 that the task force is set to expire January 1, 2026, and this would extend it out an additional year.
Oh. And Mr. Chair?
Senator Abler.
I just have to commend Mr. Monahan. His command of the English language is amazing. On line .16, it's going to analyze current trends, civil commitments, expungements, and vacatures. So I would like to understand the trend of vacatures, Mr. Chair. So thank you. I think it's a good amendment.
I do too, and I think and I know specifically Senator Utke and I and David, there's somebody we all know in common that this was a real issue, and that absolutely would help in this thing going forward. I think this is good. So all those in favor of the Senator Makewaid.
Thank you, Mr. Chair. I'm sorry. So I'm just going back and looking at the session law. I'm looking at the duties of the task force, and I'm just wondering if this fits with that, because it's about service provided. I guess I'm just the expungement, vacatures, the vacatures, the vacatures. Is this judiciary? I'm struggling with the place and then the duties of this task force that expires January 1, 2026. Does that fit with what they're supposed to do?
Senator Abler, do you know?
Well, I'd say absolutely it does. If you read on line 1.4 to 1.12, it talks about what it's supposed to do. So it's evaluating statutes related to mentally ill and dangerous commitments, and also recommendations to optimize state mental health resources. And I think it's a very appropriate place to consider what happens if it goes wrong and if they're in one of those places. So I believe it can be improved upon going forward, but I think this is something that it's a gap in our system, and if there's a better way to write it or replace it going forward, I'm eager to do that. But I would hope that we can do this today and help these individuals who are a small number but to provide eventually the relief they might need, at least a method about how to talk about it. This only says, let's talk about a method. It doesn't create a method. It doesn't turn anybody, nobody gets a vacateur experience yet. That's probably the wrong use of that word.
And when you look at this one, if you look at, to me, the heart of the argument is 1.9 is where it really starts that process that a former patient may seek in order to expunge or vacate. That is a real issue that nobody could fix for these folks that had lived experience in that way. So I think we're onto something here. I'm okay with this. Does that answer your question, Senator Mayquay?
Mr. Chair, well, I'm not going to stand in the way.
We're good?
Yeah.
All those in favor of the 826 say aye. Aye. Opposed, same sign. Thank you. Nice work, people. We're going to go, Abler, you're up again. A27, Jim, it's a direction to the commissioner, and this is where there's going to be handing this out without needing prior legislative approval. We're asking the commissioner to temporarily restructure, consolidate, or pause programs administered by the commissioner during periods of financial hardship to accomplish the mission of the department in creative ways. I mean, that's an ambiguous thing, but the issue here is the commissioner must notify the chairs and ranking minority members with the jurisdiction about any programmatic changes into effect. Does that seem what you were intended to do, Senator Abler?
And thanks. And Mr. Chair, so I'll move the amendment to get it in front of us. The issue is this. We don't know what's going to happen. We already know one thing that happened. There's proposed Medicaid cuts. The CDC did do some cuts. $26 million to VHS, $224 million, I think I got those numbers right, to the Department of Health. As a result, the Department of Health felt compelled to lay off, I think, 170 people, including some people who weren't even in the blast radius of those, which I don't understand that part. And I don't know if they were barred from doing it. And I think this language could be improved upon going forward. But the intent of it is, I intend to offer this tomorrow in the other committee for the Department of Health and DCYF. I don't know if DCT needs it, but if they do, I don't mind adding that in there. But so we have these. You and I think, Mr. Chair, that they can just move money whenever they want, and if they want, they seem to. But sometimes they aren't really as flexible as they might be, and we might want to put some guardrails around this. But I do not want the department, if something happens for $26 million, to totally ruin Wellness in the Woods if they don't have to. And other programs like that they could say, well, let's support them a little longer. We think let's soft land this a little bit. So that's the idea. And so it gives flexibility. I will take advice from people moving forward about how to make it.
I think Senator Mayquay and Senator Rasmussen. So Senator Rasmussen first.
Thank you, Mr. Chair. Question for Senator Abler. How is financial hardship defined in this amendment?
Senator?
Periods of financial hardship. I'm just wondering, when would we know that the commissioner would be able to, basically without legislative approval, start restructuring, consolidating, or pausing programs? I'm concerned that there's maybe too much discretion unless we have that defined.
I believe it's a hardship in a period of time that relates to finances. That was just facetious. So this is a placeholder. We don't know what's going to happen. I don't want to give the department just a blank check. But Mr. Monahan was very gracious and came up with this language to get the idea across. And I would love to work with anybody to correct the parameters of programs we really care about. But I do not want, we're going to be out of session at some point. And we don't know what's going to happen. I'm not trying to be pejorative to them or anything, but what happened at the Department of Health, where they, with a $224 million or whatever it was, change on a multi-billion-dollar budget, the choices they had to make, I didn't like them. And so maybe I can work with you to clean it up, but if we can just stick it on there for now, I would love that. So that's the whole point.
Senator Mayquay?
Oh,
sorry, Jordan, a follow-up. I'm sorry.
Thank you, Mr. Chair, and thank you, Senator Abler. I just think this language needs more work, and I guess we could offer it at a later stop around the floor, because I just worry that this would give the department too much power to basically say, okay, we're declaring that we are in a period of financial hardship, and that just allows them to do whatever they want in creative ways. And so I think I understand the intent, and I think we do want to make sure that agencies have some flexibility to respond to events that come up. But I worry that this could give them too broad of authority that might get used in ways that we don't know about today. Thank you, Mr. Chair.
Senator Fatse had he made the same comment Jordan just made. It was just funny because he was saying the same thing. What is it? But I got to follow up to Jim. Senator McQuaid, did you want to?
No, thank you, Mr. Chair, and Senator Abler. I want to. Obviously, this needs work, and I would be happy to work with you on specific language. I think that there's other ways we can word the language, but I just want to recognize that you're recognizing. Like what's coming down the pike, right? They have to cut $880 billion. It's going to come from Medicaid. And what happens if we don't get back into a session fast enough to pass a bill to make the services all fit together and everything's cut off, right? I definitely understand why, like where you're going with this. And so I have no problem voting for placeholder language with the full disclosure that it's definitely too broad. We can provide some parameters on what they should prioritize or how long they're allowed to temporarily do something and until what time. But people are terrified. And this, I think, recognizes that at least folks who are in 7 days a week or 5 days a week every day instead of part-time like a legislature can have some flexibility to do something if and when, they cut $296,455,163 from Department of Health, or $55,998,150 that are temporarily disrupted. And that's only going to increase.
Well, Mr. Chair, I'd like to point out that just the department, in an effort to give them like totalitarian power to do their work, Senator Fatse said, do not give them totalitarian power.
He did.
So I just want to point out that he's trying to run to the left to get to be this other job. But I want to point out deep down, he's a really thoughtful, frugal, prudent
do you remember,
senator.
Senator McQuaid, when 2020 hit, there was Kevin Parker, Jim, you were the chair, and we were trying to allocate just the federal. We found out that the feds would allow, these are just day programs, adult day programs, to keep them open because the state wasn't providing any, the funding was, it was like, well, they have to have a match. And I'll never forget, 4 times we had a bill that passed the Senate 67-0 and was sent over to the House and the House. Do you remember this?
Yeah.
I mean, it was to give the authority to the Department of Human Services to go ahead and use the federal allocation drawdown. I mean, it was one of those moments. And when Kevin Parker, who was at the time my LA, who actually was your LA, he called. It was funny. He called the state of Washington because they were the first state to figure out how to do it, and they were giving us what the Centers for CMS wanted was just a one-pager. That's all they wanted, was to say this is what it was going to be used for, we're going to do it, right? And he said, did you have to get authorization from the legislature? And the Medicaid director said, no, I'm the Medicaid director. I made this decision based on the unique needs of people. But that, I'll never forget this argument. What a battle that was to get the, and my point is, in the evidence, something like that happens again, there's got to be a simpler path than what you and I went through.
So, Mr. Chair,
looking at this, Senator,
taking the prudent advice of my conservative friend, Senator Fatse, I do just want to point out who loves the department, who trusts them implicitly. There you go. I think I will withdraw it and work on it. We'll make it a floor amendment, and I will work with all the people who want to rein in the power and risk harm, but I will listen to that voice. So I withdraw it, Mr. Chair.
I love that. Withdrawn. Senator Fatse, to that point, since he mentioned your name and disparity.
No, I appreciate that. I know Senator Abler in his heart is a believer in big government, but I have to stay away from this one. Thank you, sir.
Well, Mr. Chair, and since we're in there, I just want to point out that I think Senator Fatse would continue the tradition of Minneapolis to actually pick up their garbage on a timely basis.
Oh my God!
Thank you.
Senator Abler withdraws the A20. All those, I don't need to get whatever. It's withdrawn. Senator Abler, you want to go to the A30 while you're at it? God, talk about a guy who had all. Then Rasmussen's next with the A6. Senator Abler, the A30. What? Oh, here, it's the Community Care Hub. This is the zero-cost changes.
Oh, yeah.
You worked on some zero-cost changes for the Community Care Hub, and it's specifically including the reporting and the outcome of the services that specifically help provide it. That's a simple thing. Josh, where are you?
Yeah, I don't know if you want to have testimony on this? You want to come down, Josh? And anyway, so this is a technical, Mr. Chair, this is kind of technical. There's the people that are going to do this, and Mr. Josh. There was an amendment earlier brought forward. This is actually going to just make it work better. So it's pretty technical.
No, you included the reporting, Jim. In this one, you included the reporting on the outcomes of the services and the specific help provided. What I'd like to see, we know that this is going to be cost savings. We had this conversation. It would be nice if we could capture those cost savings. So maybe between now and finance, you can figure out how to do a capture of those savings instead of going to the general fund to pay for, I don't know, $40 million of ethanol at every pump, and would actually go to the people that really need some help. And I said that, and I apologize to people who like ethanol, but it was just, it is what it is. Any questions to the good senator about the community care hub? Unless you all want Josh Berger to come down here and repeat. Nope. All those in favor of the 830 say aye. Aye. Opposed, same sign. Thank you. The 830 is added. Senator Rasmussen, I got the A6.
Thank you, Mr. Chair. I move the A6 and happy to describe it.
Go ahead. It's yours.
Thank you, Mr. Chair. So as I talked about earlier this week, this was an amendment that I offered that would allow additional supportive housing units for substance use disorder services within Otter Tail County. We don't have a fiscal note on this yet, Mr. Chair, but what I'll say is that it's scalable. And so as you go into finance, and again, this would allow Otter Tail County to provide more assistive housing beds within the county and to vet providers that are high quality and especially focused on helping individuals experiencing substance use disorder get back into the workforce. And one of the really impressive statistics that we talked about on Monday was greater than 70% placement rate into jobs in the community, and that leading to a very high success rate, I believe of over 70% of people successfully completing their program.
I appreciate you doing this, and I'm glad you brought that up, because as David, Zach, as we're going through what are the things we're still waiting on fiscal notes, what it's going to be. Let me remind everybody. Remember, we did this last year too, and we had all these things that I just need to remind members. Any adopted amendments with a cost, we are going to either have to balance this thing into finance after looking at the effect of all members. So just remember, it's the same thing. And Glenn, this is what we do here. I told everybody in energy, so I'm just reminding members that you guys are still okay with that, right? Correct? Okay, good. All right, thank you so much. All those in favor of the A6 amendment say aye. Aye. Opposed, same sign. Thank you. Senator Rasmussen, I don't have anything else under your name unless you do. We're going to Utke. Come on, Steely Dan, A19. I've been waiting. I'm so glad you got the A19, because now that song is in my head.
Mr. Chair, you've waited all evening I will offer the A19.
Thank you so much, Senator Utke. You want to tell us about it, or you want me to give you a rundown?
Nope, I'll jump in and describe it here as people get the amendment. We go back to the last of our testifiers hour or so ago.
Yep.
And Ms. Grafstrand talked about the last section that she highlighted was started on page 83 was section 35, but what we're addressing is actually on the top of page 84. Mm-hmm. And the reason for the amendment, you go to line 2, the end of it, it says, including but not limited to, and we know how that one works. It's like it's everything from A to Z. And so as you look at the records that are below there that they're asking for, at some point we need to put some common sense into it. So this tightens that up, but also if you're looking at payroll records, it isn't as of today. You need to be looking at, if you have a new hire, they're going to go up a little quicker in their wage increases. You're going to sometimes hire temporary help. You're going to do all these various things in your operation, and we need to look at the overall picture or the average. And that's what we bring forward with this is one is to get rid of that wide open but not limited to, but then also bring in the common sense of how we look at those pay scales for our staffing.
Thank you, Senator Utke. I saw that was part of it. So any questions for Senator Utke, members? You're going to, the way it out, they're going to there's going to be some discussion, between the other body and here on that, but, that's why we're doing what we're doing, right? It's just keep the discussion alive. Senator May Quaid, question to Senator Utke.
Thank you, Mr. Chair. Senator Utke, so just so I'm clear, I'm actually going to start maybe on page 83. For this rate exception, providers only need to submit the pay scale for staff working in the setting and description of other costs instead of the payroll records for direct care wages, payment records or receipts for other costs, and documentation of expenses that were identified as necessary for the initial rate exception. Are we going backwards in kind of accountability here, or tell me more?
As Mr. Chair, as an example, let's just take line 3, payroll records for the direct care wages. Now, they fluctuate. Like I was mentioning, if you have a new hire that they're getting their increases faster than someone that's been with you a few years. And then you also have the fluctuation. You may need a temporary staff. You may need these things. So you just can't get them right down. That payroll record isn't going to be a clear reflection of your true operating costs going forward. And we've seen Ms. Grafston has joined us at the testifier station. If she would like to weigh in on that a little bit.
Senator May Quaid, you want Sarah, you want to?
Yeah, Ms. Grafston, I would, question to you.
Question to you. Help us understand why. What this is supposed to tighten things up and do it, but to Senator May Quaid's point.
Yeah, thank you, Chair Hoffman and Senator Utke and Senator May Quaid. So I will do my best to kind of try to answer your questions about the process when requesting a rate exception. I certainly would love to draw in some providers that could maybe talk to you a little more about all of the different documentation that goes into requesting a rate exception. It certainly is not just these two things. There's quite a bit of work that goes into a provider working with their lead agency on requesting a rate exception, different documentation that's required within that rate exception process right now. These things are in addition to that. And so these would be new requirements as the provider's looking to get a renewal for an existing rate exception that they would need to be showing payroll records from the previous year and those receipts. As Senator Utke shared, that's I think challenging for providers as we look at when requesting a rate exception at the beginning of a service year. It is prospective. It is what you think you're going to be paying staff, what you think your staff patterns are going to be, and that can change relatively quickly. There's also a lot of different staffing patterns, like Senator Utke explained, that providers implement. So you get the rate exception, you bring in a staff at a certain wage, and after a certain level of training, then they get a higher wage. Those things, I think would be hard to translate into those payroll records. There's also times where there might be a home that a provider is supporting multiple individuals with the rate exception that all have higher supervisor wages associated with that rate exception. Now, if that supervisor is supporting all individuals at once, how do you individualize that out in those payroll records? And so that's why we're trying to find a balance between making sure that we're accountable for what is being requested, but also kind of the day-to-day of actually providing these services.
Thank you.
Senator May Quaid, you raised an issue too, and Sarah, did you and Senator Utke, we know that this is an integrity issue. That was what they were trying to deal with. Is removing these sections in here, does that remove a savings on the spreadsheet? Did you work with Elise Bailey on trying to getting this down to where it's not? Because I think one of the assumptions in our target was that having these ones, having the ones above, shows us savings. And does this change that potential savings? Senator Utke, does that pop up at all?
Actually, I don't know, but just looking at what we're talking about, it really shouldn't, because I don't know how you can fine tune it that tight. Yeah, because from month to month, year to year, these things do fluctuate. You got within a narrow parameter, but yet I don't see how you'd put numbers to it.
Okay, that's one of the things I would have so one of the things I think to think about is if that is, remember, if all of a sudden it gets flagged as now this changes, you're saying it's not, but if it does, just know we're going to have some kind of balance. Well, how did we do that in the past? If all of a sudden we found out that this, because we do have, this is seen as a cost savings, Jim, and it's like, what have we done in the past that said, well, no, if all of a sudden now these little tweaks are not going to be a cost savings? It just hit me on that, and I don't know why. But
Mr. Chair, there's two choices. One is you can acknowledge their cost. The second choice is like, nah. Just don't take it out of their coffee fund.
All right, so just know he's shaking his head. So if we need to do some, you're going to have to make some decisions on here. I would like you to go and, I think I'm okay accepting, this, because knowing how we've worked in the past, if something doesn't fit, it ain't going to come through in the other end. And we got now until the floor to really do some fixing. So Senator Utke, you want to move for the A19 amendment, is that correct?
Thank you, Mr. Chair. Yes, I'll move that we accept the A19.
All those in favor say aye. Aye. Opposed, same sign. Thank you. Thanks to you guys for being flexible, and thank you, Sarah, because if there are changes, please get with Elise Bailey on this and see what you guys are doing. Does that make sense? Now we got Senator Mohammed.
Mr. Chair?
No, Senator, Utke.
I don't have an amendment I'm going to offer a number on right now, but I do want to bring up one more thing for us to consider, or for you to consider as we move forward.
Table's yours.
We heard testimony earlier on, again, that, and this started in the front on page 24, section 17, it goes down through. I don't know how many got an email today from a provider that's got just short of 100 different types of different locations, various things from your nursing homes to residential, etc., and saying how much section 20 and 21 would hurt them, and that would cause us to lose providers. It kind of goes back into that topic of how are we going to keep them alive with these reductions. And so I would just like to have that on your plate, going back to page 24 and 25 as this moves forward, that we keep that topic and what those different sections are doing in consideration. We've got to make sure we don't do harm to these places that are telling us now that, if we don't do something, this 96 or 97 units is going to be smaller in a year or two, and and that's just one organization. So it's just bringing it to the
No, I'm glad you did, and
thank
you for bringing that. I think one of the things that we tried to do when we laid this out was to try to go, I hate the fact that we are having to do, if the assumptions are we're going to be in a deficit, right? And so we battled to get us at 25% of, those assumption battles. So now it is in here. And part of the stuff that we did, me and the staff and the folks, was to try to do equalization across the board on that, right? So if there's a disparity on something, financially disparity, because what I don't like what the House is doing or the other bodies doing. They're really dipping into DWRS, right? I hate the fact that I think we should be bold enough to say raise taxes. There you go, Jim Abel, I just said it. Yes, Paul, you're cringing right now, but doggone it, there's all the things out there and say we need to pay the priorities for our people, right? And these are our most vulnerable. So thank you for pointing that out. Please don't lose that conversation as we're going forward. But also let's remind ourselves where's the balance on here as well too. So thank you for your work on everything you're doing. I think you got some more stuff to do before we get to the finance of the floor.
Mr.
Senator
Chair.
Fata.
Oh, yeah.
The Disabler caucus approves raising taxes.
God, you guys are
Mr. Chair.
We moved and voted on his amendment, right? Yes, we did.
Yeah.
So Senator Abler, go ahead.
Mr. Chair, I don't think I have any more amendments, but so I just want to point out about this raising taxes, Mr. Chair, you already did, but there's a caveat to that. So who raises taxes more, Senator Hoffman or Representative Schumacher? Whoa, you're like the fiscal conservative tax raiser.
I am.
You are a blue dog.
I am. No,
the governor raises taxes more.
Hear
than
his
Senator
argument,
Hoffman.
because they raising taxes because they're doing all these shifts to counties. And what did we do? We integrally, we said it's balanced.
Well,
so there you go.
You have a lower number. It's still an increase, but you have the least of the large, ridiculous increases.
Senator McQuaid wants to be part of that conversation as we go on. Eric Nauman's here. We're not doing any school shift stuff, Eric. I'm sorry. We're being true to the target. We promised you we would do that.
We're raising property taxes, but yeah.
If you want to do your amendment, I got Mohammed. I go in order, but if you want to go.
Go in your order. Okay. Go to, Mr. Chair, may I offer the A41 amendment?
You can offer the A41. May Quaid, talk to us.
All right. So I've talked about this a lot in this committee and other committees. This amendment, while not proper, would repeal the tax exemption for air flight equipment, the tax exemption for VIP preferred seating in stadiums, the tax exemption on data centers, and the mortgage interest tax deduction for second homes, and then the tax exemption for airplane parts. In fiscal year 26-27, this would generate maybe about $353 million.
Wow. How much?
$353 million, Mr. Chair.
Can we get it from the general, make sure it stays in human services? Did you do a...
Mr. Chair, your microphone is not on.
Did you do a forecast grab on that too, to be able to do a shift so we keep it here?
Well, Mr. Chair, I'll be honest with you and say, I don't think we can, I think Eric Nauman might die if I do this for real in this committee. But I'm saying this for folks who are in the audience, I'm saying it for anybody who ends up watching this. The A41 amendment is a bill that exists, it's half a bill that exists, that we could pass as a Senate and have $353-ish million to work with in 26-27. And it would be more like 400 in 28-29. We make choices when we make budget documents, and it is a choice to cut nursing homes and give tax breaks to data centers. It is a choice to cut CADI waivers and DWRS and all of those services and keep tax breaks for VIP preferred seating. If given the opportunity, I would vote to end these tax exemptions to fund the things that we need. Those are choices, and I know what choice I would make. So I want people to be able to see that. I want people to know that it is a choice we could make. And if we don't, people should know that we chose not to. Correct. So this is the A41 amendment. If anybody wants to ask me questions about it, I will withdraw it eventually because I don't want to kill any nonpartisan staff. But this is real, right? Like, these are things we could do today and not have to make these cuts. So as we're sitting here and we're like, oh, this sucks and it's hard to make these cuts. We don't have to make shifts to counties, but we, the legislature, are the only ones that can repeal these tax exemptions. Counties can't do that. Local government units can't do that. Nursing homes can't do that. Parents with PCAs can't do that. Skilled nurses can't do that. We can, though, and we should.
First of all, thank you. I thought the only people that had any kind of, for years, when I saw Nauman, because Jim and I have done these little shifts in the past, but to hear somebody going, no, this is a legit thing, I appreciate that, and yes, I agree with you. So Senator Rasmussen and Senator Abler. So thank you, Aaron McQuaid.
Thank you, Mr. Chair, and to Senator McQuaid. Has this had a hearing in the tax committee, or is Senator Russ going to have a hearing on this bill?
I love that. Aaron, what do you got?
Thank you, Mr. Chair, and Senator Rasmussen. I do not try to predict Senator Rust's behavior, but it is a bill. It does exist. It has been introduced, and it is available for a hearing if and when anybody would like to do it.
Oh, my God. This is so cool. Thank you for your work at this, Senator Rasmussen.
Thank you, Mr. Chair. And I'm just reflecting back on earlier in today's hearing when I was scolded for talking about something in the Health Committee jurisdiction.
Oh, God, you guys. Okay. Will you please accept my apology?
I'm glad that, I think it's fine that, Senator McQuaid introduced this as an idea. I'm glad she's withdrawing. But, again, we'll have this conversation, as we continue that. There are trade-offs and there are priorities, and we need to think about the budget in a comprehensive way. I don't know exactly if all of these items are the right way to go, but I appreciate Senator McQuaid offering them for conversation.
Thank you. Senator Abler.
Oh, and thanks, Mr. Chair. I'd like to remind you as a chair that there are no germaneness rules in a committee.
Amen.
And so if this would go on, and I would not be supporting that, but this would then just take the bill to taxes on the way to finance. And so it would certainly make news. And so I'm not suggesting we do it, but it's an option of the committee. who knows what happens to your bill after that. But I do want to point out in the spirit of dynamic fiscal scoring that if we take away the data center tax exemption, which I understand, it may actually mean a data center doesn't come here, which would be a bad thing, I think. And there's a lot of people who want data centers to come here. Let's see, which trade group wants to come?
Glenn's already got one.
Carpenters, sheet metal workers. Some of those individuals would enjoy having the opportunity to work and feed their families and pay taxes on that because they get paid pretty well. So just offering that helpful thought, Mr. Chair, which is why I would not be supporting the amendment.
Senator Fatsa. No, I thought you had something you wanted to say to him. You let it go. All right, he was ready to jump. I appreciate that. What do you want to do with the 841?
Mr. Chair,
You want to withdraw
we have
it?
hovering staff. I think that the only thing that we are allowed to do in this committee is...
Good job.
Is,
you got somebody's attention. If they got hovering staff over there, that's impressive.
well, I hope I got the right people's attention, Mr. Chair. So with that, I will... Well, the one thing I will say before I withdraw the A41 is that part of the reason why we could repeal the tax exemption on data centers is because we have something that other states don't have that they want, which is cold air. That's why they want to build here. It's because we have a cold climate, and that will always be the case.
And Glenn's already got one in his backyard, so.
Anyway,
it's up to you.
I think we all might very soon, Mr. Chair. So with that, I will withdraw the A41 amendment.
Thank you, Senator Mayquaid. I appreciate your passion and advocacy. This is why I like this committee. Do you want to go on your other ones, or do you want to go to Senator Mohammed?
Mr. Chair, I will offer briefly the A38 amendment.
Okay.
I believe that this does not put the bill out of balance. I'm going to look at David, but this was the number I was given. So this is not trying to be out of balance. This was the number I was given that would fit.
Scaled down. Okay. Members, go ahead, talk about it. It's being handed out.
Thank you, Mr. Chair. Members, this is a $125,000 appropriation in fiscal year 28 and a $125,000 appropriation in fiscal year 29 for senior nutrition programs.
Senator Rasmussen.
Thank you, Mr. Chair. Question for Senator Mayquaid. Who does this give the funding to? Is there a specific agency that is administering this program, or I'm just trying to match where these dollars would go?
Mm-hmm.
Senator Mayquaid. Senator Mayquaid.
Thank you, Mr. Chair. I underneath all of these papers somewhere is the explanation. I'm just going to look it up and give you the statutory reference really quick.
Just scaling it down. Interesting. Senator Rasmussen, follow up.
Thank you, Mr. Chair. Maybe, I don't know if nonpartisan staff knows where this appropriation would go to.
Mr. Monahan, educate us on corn cans.
Mr. Chair, Senator Rasmussen, the money that would be, I guess this would increase the base for this program, and it is administered by the agencies on aging, the area agencies on aging. So the money is appropriated to the Department of Human Services. It's passed through to the Board on Aging, who passes it through to the area agencies on aging to do their nutrition program.
Senator Rasmussen, then Senator Abler. You good, Senator Abler? You?
Well, I just have a question. I just don't know how this doesn't put it out of the balance of your target, but I believe, since Mr. Nauman is here, I believe this committee has the authority to add whatever they want at this level. But by the time it gets to the author's amendment at the committee that he sits on, it has to be equalized. So, you know, what are you going to cut to make it balance? Or how does this, however, not put the bill out of balance without having to make you do more work between now and finance?
Correct. I mean, that was our promise was to keep it within the target balance. So, Senator McQuaid.
Thank you, Mr. Chair. I'm going to look just to your right, but I believe that when you take the sum total of all of the amendments that are coming, this does not put this out of balance. If it does, I'm happy to withdraw it, but this is the number I was given.
What amendments are coming?
Well, I suppose we could, you know, if we do it again, if we run into the same problem that we're at, we would just, do you want, Mr. Raymond, do you want to help us? Do you want a cogitorum with that?
Mr. Chair, Senator McQuaid, so I'm not aware of all the amendments to come, or if there's been a plan made to offset this cost. So the amendment by itself would put the bill out of balance, although I will note there are a number of amendments that have been adopted to the bill that also would have costs that would bring the bill out of balance. So it's possible that maybe there was funding identified that could offset this cost, but I'm not aware of that.
Thank you. And Mr. Chair, if we're out of balance, then what's $125,000 to seniors for food?
Yep. No, and in the past we've created an amendment to balance to finance, and so that will help. And I remember the language. We'll have to pull it up, Jim. But that will offset and will.
Well, Mr. Chair, I mean, the amendment to balance and finance comes from you when you get all the fiscal notes and all the little pluses and minuses go there. And so if it's the desire of this particular member to put more emphasis in this piece of legislation in senior nutrition than the chair was interested in doing, that's what can be done. And it may well be that you can retain that, or if that's the last thing to do, it's like, well, as a chair, I'm not going to bring that to the committee. We're going to take it back out. So, so if you want to give it a shot, whatever.
I'm okay with that.
Is that right, Mr. Nauman? We can. By the time you get out of your committee, it has to be hitting the target.
Oh my God, he's still here.
Yeah, he doesn't trust us.
We might be killing
We
him.
heard that data center amendment. He was like, what on earth? So he's like, money. Yeah. He's like, I have another $1 billion to spend.
I said no gimmicks and no shifting. I swear to God. Remember that? I did. The guy who taught everybody how to do deep tails and stuff. It's nice to see you, Mr. Nauman. It absolutely is. So members, with that, all those in favor of the A38 amendment, say aye.
Aye.
Opposed, same sign. Thank you. You want to do the A37?
Mr. Chair, I do not.
Okay, so that's gone. Then you had another one, possibly TA front end side. That's something in there? No? All right. Then I got, oh, we're almost there. I got Mohammed and Fatah. You want to go, Senator Fatah, go down your list, and Rasmussen, did we get, you're done. God, that was, Republicans are done. This is not okay.
We said good amendments.
Okay, go ahead.
Thank you. I think we'll do the A16 first and then have that be amended with the A34.
Which one?
This is the A16. Because this one is this amount. I'd like to offer the A34 amendment, Mr. Chair.
A34 amendment. That's not, I thought that was an amendment to the A16. Is that just by itself? You're not doing the A16?
Yeah, thought I was going to do the A16 and then have the A34 amended, but I guess I was wrong. I think it's faster just to do A34.
Okay, members, the A34 is in front of you. Do you want to tell us about what you're doing with the A34?
Yes. So can I explain what the A16 was going to do and then the A34?
Well, just to the point is, this is the A34 in front of us, so what is it that you want us to vote on? I mean, you could, it's your table. I mean, you tell us what, you know.
Thank you. So we're just shifting some money from one committee. I'm joking, Mr. Eric. We're not doing that. So we are appropriating some money to the Somali Parents Autism Network. So their funding runs out in June, and we just want to ensure that their good work helping parents and young children and families with autism, or family members with autism, that they can continue with their outreach and education. They've reached out to hundreds of people. They've had community events and community education sessions and things like that. So the First Amendment A16 was going to shift from one organization to this, so it wouldn't be any cost, but the additional dollars will be coming from, I think, 3122 and another organization as well. So the A34 is a new add-on from the A16. And I can have Liam explain that if I didn't explain that good enough.
No, you're fine. If any members got any questions, Senator Abler, this takes it from something you and I have worked on for many, many years. And Senator Green, when he was anyway, you know who this is. I don't like this amendment, so I just want to tell you as the chair. So I appreciate what Senator Fatah is doing. I would say vote no on that, Senator Abler.
Well, Mr. Chair, I just want to commend the effort on helping Somali parents with autism troubles. It's a huge problem. But the trouble is when you take one group to help another group, now you've caused some harm. I believe you're deleting subdivision 9, which actually would create, in this bill, there's not a lot to develop workforce. I believe this would actually help to create a workforce for the dire need for people in long-term care. So I also would not support the amendment, even though, so Mr. Chair, the DS-abler caucus does not support this amendment.
The DS-abler, you guys used to sit next to each other, so guess
I
what?
still do.
Abler
I still
doesn't
like
support
him.
this amendment either, so
He keeps the garbage trucks going.
He's been removed from the caucus, Mr. Chair.
Any other questions? All those in favor of the, am I getting this right? It's the A34 amendment, is that correct? Okay, so Senator Fatah moves the A34 amendment. All those in favor say aye. All those opposed, same sign. No. Does not.
It's a tie. It was 1-1. And I'll offer the A16, Mr. Chair.
So, okay, Senator Fatah, you're going to go to the A16. So, all right, this is a little different than the notes you all guys gave me, but Senator Fatah offers the A16. It is a direct appropriation.
Yep,
So
and this is the
Senator
one
Fatah.
this is smaller. This is a smaller version of it that we all agreed on previously.
Okay. All right. Do you want to briefly talk about what you're trying to do? Senator Rasmussen, you got a question for him?
Mr. Chair, I was wondering if we could get the amendment. Can we get the amendment?
Ladies and gentlemen, please bring the amendment. Sean Burke, I'm sorry, you know what? When you came up here, I keep looking at you. It's like the lawyer of all lawyers, and I was like, you know, anything else you want to talk about? So I'm glad you got a sense of humor. But it's not as bad as me giving, you know, Matt Freeman a hard time every time he gets up and walks in the back of the room there. So I'm killing time to get Senator Fatah to be able to do his thing. Senator Fatah. Everybody, you just want to go to a vote? All right.
Mr. Chair.
Senator Abler.
Well, it puts the bill out of balance, but I think it's one of the, I believe, but, you know, but I'm willing to support the effort to get this, if you can find the money in the meantime to magically do it, if that's, it's balanced.
No, I think,
no,
Jim, I think
the
he's
A16?
taking it, he's deleting from one.
The A16?
If you look at the A16, I got, it said, move to
It
amend,
doesn't delete
delete
anything.
everything.
No, it doesn't delete anything, Mr. Chair. It just adds this
It just
expenditure.
adds it. So you didn't, so Senator Fatah, you're going to have to go back in and.
Mr. Chair, this is the gold from straw amendment.
Zainab's going to explain to you, Jim.
Well, no, but it doesn't delete anything. It just inserts. Okay, fine. It does renumber the divisions, subdivisions in sequence. Mr. Chair, you can take it if you want, and then it's going to have to blink off if you can't find the money. There's no. No, it doesn't. Oh, yeah, what's he, so what do you want to take out, Senator Fatah? All right, so you have to amend your amendment then. Mr. Chair, there's people looking for $250,000 up here. There's a whole audience of people out there that were like $250,000.
I know.
So find us some money. There you go.
Kevin Goodnow could find it.
Take it out of the.
Mr. Chair.
Take it out of the department.
Senator Mohammed.
Senator Fatah, I think you, on the spreadsheet, maybe Liam can help us, it will be taking from line 434. But I think you also may want to change it to 200 instead of 250.
Then I'll offer the oral amendment to modify it to 200.
So, Liam, Mr. Monahan, do you want to what the good senators just said? Does that make sense? I do have a copy of the A8 right here. Right here.
So do you want to delete subdivision 10? Why do you want to get rid of that? Like those people?
Hold on.
I mean, there's two different.
Senator Abler. You clicked your thing off. You clicked your microphone off. I thought you heard the click.
I was just trying to behave. I was informed it was on, so now it's off, and now it's back on again, but now it's off.
Thank you, Mr. Chair. While we wait for the A16, the appropriation here to the Somali Parents Autism Network, Mr. Chair, I don't know if Senator Fateh, is there a bill that's introduced that on this topic or making an appropriation to them, just so we can reference that?
Senator Fateh?
No.
Mr. Chair. You know, and I don't like having to pick somebody like more than somebody else that does about the same thing. I'm not very familiar with either group, although the people from Mangar Voices have been here and we've heard quite a bit from them. And they seem like they're squared away if they're going to get some money or not. But is there just a reason that I think the idea would be take away subdivision 10 and then give the $200,000 to this particular group. I don't know. Maybe it should just be a floor amendment after they get it sorted out.
I think so. I think let's sort it out. Let's get the language.
I don't want to vote against somebody or for somebody.
Yeah, you guys can
Sort it out. And actually, Mr. Chair, yeah, and if you can sort this out in finance.
Sort it out in finance, or you want to sit it on the floor? Let's do it in finance.
Finance.
Zainab will fix it in finance. We have somebody on finance. Isn't that great? That's the first time in the history of human services. I love that.
Am I in finance before you are, Mr. Chair?
I've never been invited to finance. They don't want me balancing a checkbook for crying out loud, so. Because I'm a tax and spend liberal, like Jim would say. You know how John did, right? Now, I just said it publicly, so there you go, Jim.
You have the lowest property tax impact of any of the three proposals.
Will you tell Senator Rasmussen that?
But Senator Rasmussen, it's still a lot of money. It's still a big tax increase.
Okay, so he's going to withdraw the amendment.
Omar, you're gonna have to withdraw that amendment. So that's all I got to tell you. Jordan, did you want to say something to? You sure? Senator Omar Fateh, you're withdrawing the amendment?
Yes.
Yes, Senator Fateh withdraws the amendment. All right. Anybody else? I think I'm pretty much.
You're not done.
Senator Mohammed.
Thank you, Mr. Chair. I have few amendments, but I will try to get us through quickly. I will offer the A18 amendment. And I could explain it, Mr. Chair.
Why don't you explain it, because you're amending the version of Senate File 1146. It's a 245D piece. What that does is, if we vote yes, which we're going to do it, we're going to force the fiscal note is what we're going to do here. This is I like this, because that's the same conversation we're having. So go ahead while you're handing it out.
Correct, Mr. Chair. We heard this bill earlier in committee. It's been heard in both bodies. It's bipartisan. Thank you, Senator Abler. It was the first bill that I think I did in this committee, and everyone loved it. We have been asking for a fiscal note, and we have yet to get one. So I would like to put it in there. I am in finance, so if we need to work out some numbers, we will. Thank you.
Senator Rasmussen.
Thank you, Mr. Chair. Question for Senator Mohammed. Senator Mohammed, could you cite the bill number that this is, just so we know what language we're looking at?
Senate File 1146.
It was like the first one we heard in committee. That was great. See how fast you rattled it off, Senator Rasmussen, to that. We should get Jordan on finance too, because then we could have two people on finance.
Senator Makewitt said no, and I will agree with her. But we don't make the decisions.
Well, then we get Senator McQuaid on finance then.
That I will agree with. And taxes.
Oh, taxes would be good. Senator Rasmussen? Nope. Microphone off. You're good? Senator Utke?
Mr. Chair, I just don't want you to go all evening and get really in trouble because you have two members from finance in this committee.
Do I? Oh, my God. I am so sorry. That's really sad. I'm sorry. We have two people on finance on this committee. Thank you, Senator, for pointing that out to me. And I apologize to you, good senator from Bloomington. Go ahead. I got it coming, Senator. All those in favor of the A18 amendment, say aye. Aye. Opposed, same sign. Thank you. Senator Mohammed.
Thank you, Mr. Chair. Next, I'd like to offer the A28 amendment.
A28 is adds the entirety of Senate File 3040, which was one of yours as well. If we fiscal note, same conversations we had with the 1146. It sounds like we're doing the same path here. Is that correct, Senator?
Mr. Chair, I don't think the bill costs us anything. Agency says it does. They have yet to give us a fiscal note. I'd like to add it to the bill. The policy is already in your bill. We will discuss it in finance.
Members, this is that adaptive swimming. This is that thing that we heard the stories on. We really want to pass this. And you know what, Senator, both the other body in here, the same members, Senator, this committee wants to see this happen. So, Senator, yep, thumbs up. Senator, anybody? All those in favor of the A28 amendment, say aye. Aye. Opposed, same sign. Thank you. That's done. You going to do your caddy one?
Yes, Mr. Chair, I'd like to offer the A35 amendment.
Thank you.
Obviously, we all know you have to make tough choices, but we want to make sure that as we're doing that, we're also being thoughtful and cognizant. And so what this bill does is it's purely language. So it still lets you make the savings that you need to, but it does require for the individual who does qualify for the waiver individuals who do qualify for this waivers under disability do stay in the program, and that those who do qualify just on homelessness are going to be removed, but we're going to give them 90 days instead of 30 days for folks to have the opportunity to appeal. And also to ensure that folks are offered other services, especially at a time when homelessness is at an all-time high. Happy to take questions, Mr. Chair.
Wow. Nice job. Senator Abler.
Thank you.
Well, Mr. Chair, this will probably generate a fiscal note, but I think it's a worthy discussion, so I would be happy to support it.
Awesome. Senator Mo, anybody else? Questions? Senator Asmussen?
Thank you, Mr. Chair, and I'm just trying to digest the amendment here, but I think, one of the reasons that this was included in the bill is to try to take a look at eligibility. Yeah. And I think that was an important piece to make sure that we're prioritizing resources for the Minnesotans who need it the most. And I think when we look at this determination under current law, and this would be changed in your bill, you could have an individual become eligible for the caddy waiver solely because they're at risk of homelessness, and not necessarily because of other criteria that we would categorize as a disability. And so I think, there are savings in your bill for this, and I'm curious to see what DHS comes back with and says, how this impacts the savings that you've booked in the bill for this eligibility change.
So can you, thank you for that, and thank you, Senator Mohammed, for bringing this, because the question that always came up was, and you heard this, and I'm gonna make light of this. Two bodies other than the Senate, can I say that right, have said, it's growth. You gotta get the growth under control, right? That's all they keep saying to me. How was my invitation? Pretty good. And in this case, and you look at the caddy, because we're doing that, right? I know, Senator Rasmussen, that you're working on some language on 65 caddy. I mean, could you two figure this, work out? Because I think when you look at the 6th point that says I'm eligible for nursing home services, right? I'm going to just use this as an example. The at-risk for homelessness should automatically kick in. That person should be getting supports and services some other place than a nursing home, right? Like housing stabilization. I'm throwing that out there, but that's another issue to talk about. You two are hitting on something I think that we should be absolutely jumping into and trying to find a systems approach to that. So that makes sense? Senator, talk to me.
Thank you, Mr. Chair. And I just think too, it's important when we're looking at the issue of homelessness, which is an important issue, that we have programs that are targeted towards reducing homelessness and helping in that area. And we don't necessarily just have it be an automatic, we're putting someone on a disability waiver. And I think, Mr. Chair, that's part of the concern is, are we having individuals going on the disability waiver when they maybe should be getting, other programs that are designed at preventing homelessness?
Senators and Senator, go ahead, Senator. Yeah.
Mr. Chair, thank you, Senator Rasmussen. This amendment does not do that. Per se, an individual does qualify for the waiver. Not everybody will say that they do have a disability, right? And so what we're trying to do in this amendment is we are asking for the agency and the staff to go deeper and say, okay, do you have disability? If you do, you qualify. If you don't, then we're going to give you 90 days to make sure that you have the appeal process.
All right, that makes sense to me.
Yes.
Senator Rasmussen, if there's a cost, you'll be working with Elise Bailey shaking her head yes, so you guys will figure that one out. Thank you very much. All those in favor of the 835, say aye. Aye. Opposed, same sign. Thank you. Anybody else? Did you want to discuss?
Mr. Chair, I have one last amendment, I believe.
Do you have one that we can like shift money from one to it? Forget it.
I sure do. 818, Mr. Chair. You may love it, but I assume you probably will not love it. It will save you $500 and some thousand this year, and on the tails, the same. So I'm saving you money. It is a bill that was introduced by Senator Fate in March, and I think I have made it very clear that I am not a fan. I was hoping not to do this, giving opportunity for providers and folks to come together and come up with language. You did, Mr. Chair, promise me that this bill, if they don't work it out, would go to judiciary. It has not gone to judiciary.
Is this the A18? No.
Oh, wait, sorry. It is the
A39.
A39, Mr. Chair. It removes the entire bill that Senator Fate has until at least we figure out what the plan for it is, because you included the bill.
All right, so Senate File 2055. Is the 839 coming around for people? Which parties? So we're talking about, do you want to bring somebody up to the front, Zainab, or Senator Rasmussen, did you? No, somebody turned their mic on.
Mr. Chair, if folks want to, they can. I'm bringing it forward because when we discussed Senate File 2055 with Senator Fate, he did say that folks were going to work and have an agreed language upon, and what's in your bill is not the agreed language upon. At least to my understanding, I certainly don't agree with it. And so I want to make sure if providers are going to evict folks, that there is a plan for those folks, because the people who are being evicted don't have lobbyists and providers do.
Go to Senator Fate. Thank you. Now, thank you for clarifying that, Senator Mohammed. Now, Senator Fate.
No, absolutely. And I had the same concerns. This was just a bill to have a start a conversation, and I think the providers and the agency has been having good discussions, and they're almost there, but the language wasn't yet correct.
Okay.
They indicated they will have the language correct by finance. If not,
by finance?
Yeah, if not, we can pull it. But I do share the same concerns as Senator Mohammed, but I wanted the opportunity to.
Now that I've been reminded that there are two members from this committee on finance, does that sound like something Senator Wickland and Senator Rasmussen? Yeah, Senator Rasmussen, go ahead to Senator Fate's point.
Thank you, Mr. Chair. And I'll go back to the policy markup where we had also some language that there was still some work to be done, and I think everything left committee that day. So
you're right.
I would encourage, us to look at keeping this language in and continue to work on it.
Okay. All right.
But that would be my thinking, just to make sure we have that placeholder.
And that's a tradition of this committee, is to do that, because we, the folks that remember the two policy ones, I did get an update on one of them, and they're working on some stuff, right? So and if they're not, if things aren't done, then we make a decision on the floor what that's going to look like.
Mr. Chair, we'll have that marker in the bill, and if there's something figured out by finance with the amendment author is a committee that she sits on, then
we're good.
We can take it there.
I think that's a good idea. Senator Aaron McQuaid.
Thank you, Mr. Chair. Slightly different vibe here. I mean, if the chief author of the bill is sitting here saying that he's still not there, I think we should take it out, because if it would be different if he was saying, I think we are working on it, I think we have a place to go, let's leave it in. But I'm not hearing that from the chief author, and I think that means we should take it out.
Matthew Bergeron, you want to come down here? Because now you're going to have a split committee. Aaron McQuaid, take it out. Fata, if he, you folks are working on something, come on down and tell us what. Because I'm with Senator Rasmussen. I believe in sending it, because this has been the history of this committee, is to send this stuff on, and y'all going to work on it, and if you don't work on it, we deal with it. Right, Jim? Yeah, some thumbs up. So can you do a quick 30-second dirge? Because her concern is if he's not happy, then let's strike it out. Let's pull it out. Right? And if the case is no, he's happy, you guys are working on it, and y'all are saying you're working on it with the people that need to be there, then we do the tradition of this committee and move it on and work. Does that make sense? Yes? Matthew Bergeron.
Mr. Chair, committee members, Matthew Bergeron with Larkin Hoffman, represent the Residential Providers Association of Minnesota. We continue to be in conversation with Mr. Burke and the coalition that he's working with as well. I would say the number of issues that we're talking about has shrunk. We found some compromise language on a couple of items. We found a couple of other places that we think we might be able to resolve something this year, and we've found a couple of places that we think we may be able to resolve something, but probably not until next year, and would be moving away from that. So I would just say we're probably 75 to 80% of the way on agreement on a portion of things, and then would be, moving forward from there. I'll defer to, Mr. Burke to speak for his perspective.
I'm hearing what I'm hearing. Jim saying leave it there. Mr. Burke, you want to?
Mr. Chair, members, yeah, I would agree and echo Mr. Bergeron's comments. I would probably not go as far to talk about like where we might be next year, but in terms of the narrowing of issues for this year and passing stuff off for the interim to keep discussion is fair.
I think you got it, Senator. It sounds like this tradition. Senator Fata.
No, it's fair for her to ask, I think, Mr. Bergeron what her main concern is, so that he can address it also.
Senator Mohammed.
Thank you, Mr. Chair. And I think he knows my concerns. I've asked them all on the record, so I assume he has them. Thank you, Senator Fateh.
Right. So I think we're just going to, you just want to do it up for discussion, so we're going to withdraw that amendment. Is that correct?
I will withdraw it with the agreement that there will be an agreement by finance, because I would like to not have this discussion in finance, Mr. Chair. Thank you.
You got shaking heads around here,
So with that,
go for it.
I
If
will
not, then
withdraw
you and Wickland
the.
get to do what you want in finance.
I will withdraw the A39 amendment. Thank you, Mr. Chair.
Thank you. It's A39 is withdrawn. Anything else?
I have a couple.
Senator Fata.
Thank you. Mr. Bergeron can stay at the seat also. I have the A33.
A33, 144G fines. People are handing it out. Do you want me to read what you got here, or do you want to just go ahead and talk about it?
You can do that. You can go ahead with that.
Fines collected. Ready for this? Senator Abler, you're going to like this. Fines collected shall be deposited in a dedicated special revenue account on an annual basis. The balance shall be appropriated to the Commissioner for the Competitive Grant Program for the purpose of improving resident quality of care and outcomes in assisted living facilities. Commissioner must publish on the department's website an annual report on the fines and how they were allocated. I absolutely love that idea.
Good.
Utke, don't you like this? Finally.
Well, no, I didn't say that.
Oh, sorry.
Where are these fines coming from?
Senator Fata, Matt Bergeron, you want to tell us where these fines are coming from?
Mr. Chair, Senator Matthew Bergeron, Larkin Hoffman, on behalf of the Residential Providers Association of Minnesota. So under current law, the fines are paid by assisted living providers when they have a licensing inspection. If there's something noted, there's a fine, it's paid, it's deposited into an account. That's current law. Those dollars are then, the Department of Health has the authority to receive recommendations from, all right, let me rephrase that. The Home Care and Assisted Living Advisory Council can make recommendations on how to use those dollars to improve quality in patient or resident care, and then the commissioner has the authority to use those funds based on those recommendations. Historically, however, the advisory council has, I think, struggled to reach consensus on how to use those funds, and those funds have sat in the account. What the amendment would do is it would give the department the ability to kind of separate from that, issue an RFP, competitive, look at proposals for how to issue things, and then go forward. The providers have seen these dollars sit there and not be used for that. The department, I think, has had some frustration and even has some language in their bill as far as that process. This would just give it a clear path towards utilization on an annual basis, which I think was the original intent of the law. It's just kind of caught up in the advisory council recommendation process.
Senator Etke.
I hear what they're doing, but they didn't do it the first time. Why are they going to do it with this?
That's a great question.
God believe.
Matt, you want to answer that?
Mr. Chair and Senator, what the amendment would do would clarify the department's authority to issue an RFP, search out opportunities to use these dollars to improve quality, and then allocate the money towards that, absent needing the recommendation to originate from and have consensus of the Home Care and Assisted Living Advisory Council, which I think has historically been the obstacle to these dollars going out the door and being used for anything. I think they have been generally not utilized. That's funny. Fiscal staff or somebody would have to be able to speak to what the balance of the special revenue account is, but this is an attempt to kind of clear the backlog or clear the roadblocks so that the department would be able to use these dollars for the purposes that the underlying law already says they're supposed to be used for.
Senator Etke.
Thank you, Mr. Chair. And again, I fully hear what you're saying, but the fact is, I guess I would like to see a little more detail. Are these going to, can providers apply for these grants to increase the quality, or are we going to be just, once again, handing out a bunch of money to prospective nonprofits to kind of come up with something, which seems to be a trend we do a lot of. So I'd look for some clarity there. You know, if it's going to, if these are grants that would go to assisted living facilities, they, you know, through the grant process would say what they're going to do to increase quality. That would be something I think I would buy into. Just letting anybody come in and apply for these grants, and again, most of it goes to nonprofits. That I wouldn't support.
Do you know if, to Senator Etke's point, do you know in those special projects that they have to improve the resident quality of care, they have special projects, how is that funded and how do they do those special projects? Do you know offhand? Because it's already an existing place to do it. This just gives them the ability to create the competitive side of it. I know there's that special, because the special projects to improve quality, that's been there forever, right? And if I'm, but to Senator Etke's point, could you get some TA, Senator Fatah? I love this. Jim and I are already thumbs up on this. I saw that. So, but to Etke's point, I know the special projects how is that going to look? Because I like this, because it's staying within the department. We're doing, you know. So, can you fix that? Can you get that taken care of by your next stop, or do you want to withdraw it and just do it? Senator, go ahead.
Mr. Chair and Senator, in conversations over the last couple of days with the Department of Health, they have offered some technical, this is something of a placeholder, as there would be additional details that the department would be looking for there, and I would anticipate that would be forthcoming. The goal is to just kind of alleviate, as I understand, there may be millions of dollars already in this account, and that's just not doing any good at the moment.
Mr. Chair, I would like that if you got that, and you know, so it would be withdrawn today, but could be ready for finance.
You okay with that?
I think we have to fine tune this, you know, and again. I can see where there could be some good things done with this, but I would like to know how it's going to be, and I would hope that it ends up going to the facilities. They're going to apply. They're going to tell you what you're going to do, but then that money is there to improve the residential quality. So,
on that point, Senator Fatah shook his head on that. Thank you for that. The Fatah withdraws the A40. Senator Fatah, the next amendment, please.
Thank you.
We got to get going. Jim's got to leave, or Jim's
so I'm
leaving,
going to call on Mr. Goodenow if he can while I go through the A40.
Quickly.
So this amendment is language from SF 3246. It makes changes to the requirements for the CFSS program by making the use of consultation services under the agency provider model optional, and I can have any questions provided to
Nope.
Mr.
Kevin,
Green.
you want to talk about Committee for Services supports that modifications and consultation services, there's an optional service under agency provider model specification provision. Tell us about it.
Mr. Chair, members of the committee, my name is Kevin Goodnow. I'm here representing the Community Provider Alliance. Under the FSS system, we have two different models that are allowed under that, the agency provider model and the budget model. Currently, under current law, both models allow for or require that consultation services be provided before you choose. This makes it optional for the agency provider model, but keeps it mandatory for the budget model. So it actually reduces the number of mandatory Medicaid services under this. So if you're going directly into the agency provider model, you don't need to have consultation services, but you can choose to have it covered if you want to.
Thank you. Senator Rasmussen.
Thank you, Mr. Chair. Question either for Mr. Goodnow or Senator Fate. I see the bill file that was referenced. This was introduced on April 3rd. Has this bill had a hearing in this committee, Mr. Chair?
Senator Fate. No, it has not, Senator Rasmussen.
And thank you, Mr. Chair. And again, maybe this is really good, but it's a 17-page amendment that no one talked to me about. We haven't had a hearing in this committee on. Was introduced just a few days ago. Maybe it's great, but I just don't feel comfortable making a decision on this amendment today.
Speak on it, Senator Fate, or Kevin, you want to talk about it?
Mr. Chair, members, Senator Rasmussen, I can understand your concerns about it. It was something that took us a little while to get drafted and get back from the revisor, so we apologize for the lateness of it. It is something that could potentially save money because it makes a required service an optional one. It is 17 pages long, but it does that one simple thing that I mentioned. It's changing sites throughout the 17 pages, just bits and pieces. So there's, you know, it is what it does take that required service and makes it optional for the agency provider model. So
Senator Rasmussen. Potential savings. To your point, go ahead. Then Senator
I guess,
Mohammed after that.
Mr. Chair, again, I just.
What do you want to do?
Maybe it's great. Might be a really great idea. It's just the reason we have hearings and we, post them is we get people the opportunity to come and talk about the issues and highlight them and get feedback from stakeholders. So again, maybe this is great, but I just, it's hard to know without having that type of feedback.
Would you be willing to? Well, I mean, there's a couple thoughts on here. I mean, we have finance, and so we have two members there. Senator Fate either withdraw it and bring it to finance as an amendment, which, if it's good. But and to your point, yeah, I got to tell you, I was not happy with the amount of stress my staff were put under today because people couldn't get amendments to them in time, right? And I'm still a little saddened by that, right? And if this is one of those that it took a while to get there, then maybe we need to either have finance deal with this, have them withdraw it, and have you guys pull it up in finance and move on. Because it sounds like you have reservations about passing this, correct? You have reservations about passing this, correct?
Thank you, Mr. Chair. I just don't know exactly all the implications
Correct.
of it. So, but, Mr. Chair, I would be okay with this going on today, but just with your confirmation that if there are issues, that you guys would take it out of the bill and we would have a hearing in the committee.
Absolutely. We could pull it, have a hearing, or we could pull it on the floor. Either way, I mean, I'm flexible. This is the thing about this committee, Jordan, is we've always been flexible as long as we're doing right.
One question I have, and maybe Mr. Chair, Mr. Goodnow knows this, is would this require a waiver through CMS or federal approval? Because again, I'm just cognizant about making changes that maybe we haven't had approval from CMS or that DHS would have concerns around. So that's just.
I want to do this. Representative, Commissioner.
Mr. Chair, Senator Rasmussen, this would require federal approval. So it could not take effect unless there's federal approval.
That puts another wrench in there, doesn't it? So it's a good that would have to get the appropriation there on that. Senator Mohammed.
Well, Mr. Chair, since we're adding, we have added things to your bill that obviously your favorite senator already has issues with and we have to work those out, then maybe this should also be added, because I think bringing an amendment that's just policy and finance may be a problem, but removing it may not be a problem.
I got it. What do you guys want to do?
By the way, I too have questions like Senator Rasmussen, but I also have issues already, so.
Senator Fatsa, what do you want to do? You want us to move the 840, put it on here with the understanding what everybody just agreed to?
Yes, I think it most likely is going to save money for us. So
Senator
yes.
Utke, it's like that's our tradition here. We're good with that?
I speak for Utke, yes.
Senator Rasmussen, go ahead and clarify what we're going to do.
I just want to clarify, like if a member of this committee has an issue with this and wants it to come back and be heard, that it'll come out of the bill.
Yep, everybody's got
Thank you,
thumbs
Mr.
up.
Chair.
Senator Mohammed.
Because we're talking about saving money, I'd like to know how much and how by the time we get to finance, Mr. Chair.
I got shaken, yes. So before it gets to finance, so there's two things we're doing. This is good. Everybody okay with that? All those in favor of the 840 amendment indicate by saying aye. Aye. Opposed, same sign. Thank you.
Thank you, Mr. Chair.
Thank you, Commissioner, former Senator. No, you were never a senator. You never were in the upper chamber, were you? Nice work. I have nothing else.
Yeah, the last one, SF 2741.
Senator Fatah, what's the next one on your plate?
Last one.
It's the last one, members.
A42. And
That's not a song. A42. You're going to have to explain it to us as it gets handed out, because I don't have it on my list.
Yes, and I'll call up Ms. Zania while I'm speaking. So SF 2741 basically allows waiver case managers to authorize HSS for individuals, since they're the ones responsible for developing and seeing a person's support plan.
We heard this?
Yeah, we heard it, I think, a few weeks ago.
We did.
Is Zania still here?
Nope. Senator Rasmussen?
Nope.
Oh, I thought you were waving. I'm sorry, I'm looking at my son. A42. Is there a cost to this?
No, but DHS, I think, didn't have an issue with it, and they were offering technical assistance around the effective date and things like that.
Senator Rasmussen.
Thank you, Mr. Chair. I mean, I'm just reading through this here, and I guess I could ask fiscal staff, but I would assume that this would have a fiscal cost because it's authorizing services that I assume are being reimbursed by the state. But I just want to make sure I'm not missing something here. But
no, I'm reading the same thing.
It looks like this would be authorizing services for reimbursement. And Senator Fate, is this a bill that's
yeah, it
before
has
the
been
committee?
heard. But we can do this, Mr. Chair, also. I'm happy to withdraw it and then.
No. Elise, it looks like Elise is taking. Oh, she's just looking.
Yeah.
You want to just withdraw it?
Yeah, DHS offered TA on it, and I think they didn't have an issue with it. But
have they offered? Is this their TA on here that you have?
No, the TA had to do with I think the effective date and things like that.
So they didn't have any issues with this when they offered the TA?
No, they were working on it with the providers.
You're okay? It does have a cost, to Rasmussen's point. Okay.
Let's withdraw it, get the cost, and then bring it back next time.
Sounds good. So Senator Fatah withdraws the A42. Thank you for doing that. So anything else? So there's a few things. I don't have my sheet in front of me. I'm moving something. I'm moving to another state. I just want to let you know. It's going to be someplace warm. God, Jordan, that was funny. No, I want to pay more taxes, Jordan. Just a second, people. I lost that piece of paper. I don't know. It must have been shuffled when I handed it down the road. But Senator Rasmussen moves that Senate File 3054. You don't want to move it? I'll do it. All right. I take that back. I can't do that. I can't. Oh, all right. Senator Fatsa, do you want to make a motion? Senate File 3054. Senator Fatsa makes a motion that Senate File 3054 as amended to pass and re-referred to finance, and that you're instructing staff to do the necessary changes made that we did here, as well as updating the target, updating the finances as well. Did I get that right, Senator Edke? Did I get that right, Liam? Close enough? All those in favor say aye. Oh, Senator Rasmussen, go ahead.
Thank you, Mr. Chair. Just wanted to say a brief comment, and I do appreciate the work that this committee does and the good intent that all members bring to this committee. I do have some concerns with this bill and look forward to working with you and others to try to improve it as it makes its way to the floor. But again, I think, whether we take into account some of the testimony here today and the impacts that this will have on our counties, on disability services, and on long-term care, just want to look at how we can make sure we're prioritizing the dollars to the Minnesotans who need it the most, while also protecting Minnesotans from public services fraud. And so look forward to continuing to work on that as we go to the floor. Thank you, Mr. Chair.
I as well continue to work with you, Jordan Rasmussen, on this, because as you look at the other bodies piece and you look at what the governor sent us, we didn't have much to work with other than doing the right thing. So if we can continue to work toward doing the right thing, because we stay focused on not about us individually, but on the services and supports to the most people in the state of Minnesota that most need it, I think we're going to be on the right path. So I think this committee shows the rest of the committees how we're able to do that and still enjoy the work we do. So with that, all those in favor say aye. Aye. Opposed, same sign. Thank you. We are adjourned.